Good morning, everyone, and welcome to the August meeting of the Universal Health Plan Governance Board. We're still letting people into the room, and then as soon as Isabel's ready, we will start with a roll call.
And ready. Helen Belonga,
Here.
Chen Wei Chi, don't see Chen
He's
yet.
not here.
Amy Fellows.
Here, I'm wondering if you can hit okay so I can see Michelle's face.
Our screen is looking.
Thank you, yeah. I can see Michelle.
Oh,
Michelle.
Amy, okay, yeah,
Yeah.
Michelle.
Here.
Michelle here. You, Bruce Goldberg,
Here.
Judy Richardson is absent today, Cheryl Ramirez. Here. Mary Lou Henrich,
Here.
Mike Leahy,
Present.
thank you, everybody.
Great. Before we get started, I wanted to express gratitude to all my fellow board members. It's been a rough couple of months, and I appreciate everyone willing to hang in there and extend this phase of our work for a couple of months. We're all here as volunteers, and our time and commitment to this work is really apparent. In particular, I appreciate the several board members who have formed a work group, and we'll be hearing from them later in the meeting. Their willingness to put extra time and effort into our report to make sure it represents our best thinking is really appreciated. However, I wanted to emphasize today that the conversations we've had in the past few months and the work group formation does not diminish in any way the outstanding work done so far by our staff. I just want to acknowledge Mimi, Lee, and Isabel, who all work full-time for this board and have dedicated significant hours and professional expertise to translating our many discussions and meetings into presentations, into minutes, and ultimately into the draft report that we're working with. They've done exactly what this board has asked them to do and often gone above and beyond to make this work exceptional, especially since they all started when we were already a year into our work. So I know our intention is to build on their work as a foundation and not replace it. And I just want to officially express my gratitude to getting us to where we are.
I second that.
Thanks, Mike. Yeah, and then just to remind board members, we all know that this work is exploratory. It's obviously never been done at the state level before. We all have different ideas about what it could and should look like. None of us is in this for personal gain. And we have an obligation to the people of Oregon to make the plan simple and accessible, but also feasible and practical. And it must meet the needs of the legislature. I think if any one of us tried to summarize the work of this board in the past 2 years, we'd all come up with something different. We hear different parts of the conversation and we walk away with different key points. Please keep in mind that when we try to come to consensus, that we are all coming from this from good intentions, that we are all here to put the best product forward that we can, and it is all of our obligation to approach this work with kindness and respect. So I ask all of you to just assume good intentions of everyone in the room as we move forward, because I think there's still a few more difficult conversations ahead. So thank you. And now just a quick agenda review. After our executive director's report, we're going to spend the bulk of our meeting today talking about the revenue plan and how we got to where we are and where we want to take it from here. We have a number of other items on our agenda, but that's going to be our priority. So some of these other items may fall off if we run out of time. I want to make sure the board has plenty of time to get our questions answered and review what we need to review about revenue plan. That'll be our priority. But if we get to it, we also can look at our expenditure forecast assumptions and see if there's anything there that needs to be revised. The staff has been thinking about a phase 2 overview and plan. Phase 2 meaning, what does this board work on after our report is submitted? We have 6 more months through June of 27 where we are for sure funded to continue our work. And so what does that work look like? And then we'll have report outs from the new legislative report work group and CECC. So on our consent agenda today, we have a couple of things. We have meeting minutes from both our regular July meeting and then our special meeting that happened earlier this month. So the minutes are there from that. In our consent agenda, there's also the alignment letter that our Vice Chair Judy Richardson wrote to Governor Kotek. In that alignment letter, she called out all the ways that three groups that have been working on healthcare reform issues. All of our work aligns in several ways. So those are the Medicaid Advisory Group that Bruce was part of and Governor Kitzhaber's Health System Sustainability Group. So she put together a crosswalk of the recommendations from all three of those groups, as well as a letter emphasizing the key points. So all of those are in the consent agenda. And I am looking for a motion to approve our consent agenda. Mary Lou?
I'd like to pull the alignment letter off of the consent agenda.
Okay.
I second.
I mean, do we have to motion or just we? I don't
No,
know.
no, you can just pull it off. You can
Okay,
just pull it off.
thank you.
Okay, so is there a motion to approve just the two meeting minutes? And I'm assuming the crosswalk too, or not? I
Yeah,
don't care.
that goes with it.
Okay, so just the meeting minutes. Is there a motion to approve the meeting minutes from July and the special meeting in August?
So moved.
Okay, and is there a second?
Second.
I just had I'm fine with that. I just had some edits
I
to
did too.
a piece of it.
Are they substantive or?
Yeah, I think so.
Okay. Go ahead, please,
Well,
discussion.
one is, it's in the part that I talked about the advisory group. And it said, I can give it in writing to folks, but where it says Oregon's estimated to lose 1.9 billion, it's actually 9.4 billion. So I think that's pretty substantive.
Any edits like that, just sent to me.
Okay, that, and then there was just one where it said 421 million going into the 27-29 biennium. That makes it sound like now. It should be in the 27-29 biennium.
Okay,
And I just have one on page 5. Chun-Wei was talking about the Milliman estimates, et cetera, and Taiwan only having 4,000 administrative people. And it said also excluded marketing, but the issue was that it included marketing, and he felt. And so I thought excluded versus included. So we might look at the tape or something, but it doesn't make, because also excluded marketing, which won't be needed. So anyway, that was.
Yeah, if you can just send me
I'll
that.
give you that, yeah. Other than things, but okay.
okay, so there's been a motion, and a
Excellent.
second, and then 2 recommended edits to the minutes. Any further discussion?
Just a comment, because, you know, we've had some difficult conversations in our last meeting or two. And I definitely agree with Helen's comment that we've got to figure out how to get them together to have board conversations and discussions and debates here. But I think the intent should be, as Helen described before, that everyone really is trying their best. We know that this is very, very challenging work, and in that spirit, I would hope that I definitely appreciate the leadership of the board, but in a context here, we should be doing letters and other things really as a full board and not as, not in a way that there's a chair and vice chair and then the staff and then the board listens to presentations. I think we need to make a slight adjustment and take a lot more responsibility of the full 9 of us. And that means, compromise, coming to consensus and going forward with a good spirit.
Any other discussion about the minutes from July meeting and the early August meeting? Okay, let's do a roll call vote.
Ellen Blanca,
Yes?
Chun-Wei Chi is absent, Amy Fellows,
Yes.
Michelle Glass,
Yes.
Goldberg.
Yes.
Judy Richardson is absent, Cheryl Ramirez,
Yes.
Mary Lou Henrich.
Yes.
Mike Leahy.
Yes.
Thanks, everybody.
Okay, so you wanted to pull off the alignment letter, in the
Yes.
crosswalk, so, go ahead.
Okay, I just feel, okay, do you wanna say something?
Well, and I had a question, so when was this sent? It doesn't have a date on it, and
Was it sent?
was
or
it
is just a
sent, or
draft?
is this a draft coming to us, hopefully?
It was sent. I don't know the exact date. I'd have to go back through my email. Sorry about that.
Yeah, I mean, and I think
Yeah.
It
It's
didn't
not
come to
dated
the-
or signed or anything, so
board,
it's hard to understand what this was.
you know, is being shown to us after the fact. That doesn't feel good. It's not transparent.
And I guess my thing was that since it didn't have a date, et cetera, I assumed it hadn't been sent yet. And that we could decide if we wanted to talk about, because as I read it, there were things in there that I did not agree with. And there were others, a couple that were really good, that, you know, so I was thinking that if it was representing the board, it felt like it kind of undercut us, honestly.
Yeah, it's unfortunate that Judy's not here. She's the one that wrote it, and what I recall is that she had trouble with sending it, so I'm not actually sure if it was. It did go,
Yeah,
okay.
I'll find it, I apologize.
But I think it's more that it
Yeah.
was written. Like, we weren't even informed that this was being written, we weren't in, you know, that we didn't have a say in the content. And so like. Is it you, Judy, and the staff deciding things, and the rest of us are just. Like. You know, it just does not feel how a board should operate.
I don't wanna speak on Judy's behalf, but what I believe was the intent was that it was the board's opportunity to show support for work that was going before the governor. And to express our support for their work as well, to
It sounds like
say,
it was Judy's opportunity, because we weren't given the opportunity to have a say.
yeah, she took the initiative to kind of point out ways in which the work of this other group aligned with our work. There was no intent to sort of go around the work of the board. We just said, we're all working on these same things. We see all of our work as aligned. And we wanted to point that out to make it clear that we weren't, in any way sort of working against those other groups, that we were all kind of aiming for the same thing, which is reform of the health system in the coming years, so.
So I just think it's important if there's communications happening, especially with the governor or the legislature, that is on behalf of the board, that we should be aware of it and have a say in it before it is sent.
Okay, I second, that was my concern, and that reading. There's just been a lot lately, as you know, because you've been involved in a lot, and we all have, but trying to read the MAG, the Medicaid Advisory, the report, trying to read the, kids, I call it Kids Soccer Report, but it's got a term, HS, whatever it is, yeah. And assimilate those things, and then kind of do see, you know, and have a discussion at the board about, you know, what parts of those really forward. Those two groups were not charged with developing a universal health plan. They went at different issues. And so, yes, there are some things that seem to be like, oh, yeah, that would make sense on our road to this. I just don't know when I read this, that I agreed with all of them. And it made it sound like this was from the governance board, that this was not just from the leadership. And so that's why I was concerned, and I thought it had to be written, so I thought, it sent, so I thought, oh, well, maybe I could pull it off and we could talk about it another time and decide what we wanted to say. But, you know, cat's out of the bag.
Cheryl's.
Go ahead, John.
I agree. I would have liked to see a draft, and this may come as no surprise to anybody here, but I did not agree with the conclusions about the behavioral health system on either one of the reports. And my association is actually going to submit comments about those recommendations. I don't believe it was a realistic perception of how the behavioral health system functions today. And so I did want to say something about that, but I have the opportunity now since the letter's already gone, so, but I will do that on my own.
Does anyone want to suggest a remedy for this, or is it just to noted going forward, or?
I would, I think. I totally understand the critique that's valid, but there's also an opportunity here. The opportunity is, I don't really care that that letter was sent. No one's, kind of integrated crosswalks are nice, but no one's integrated about why the Medicaid thing on its own, whether or not it dissolves CCOs or whatever it doesn't really solve the fundamental long-term problem without some vision as to how the whole system operates. So it's Medicaid, and I get that, and groups can speak to that. There's also big issues in Medicare. There's also big issues in how this affects the economy. There's also big issues with connecting those reports to our work. And I think there's an incredible opportunity for the work group to come up with some insights about presenting universal health plan in the next few months. And I'm looking forward to being a part of that. So this isn't, I wouldn't characterize this as just kind of a process problem. I think that there's an opportunity here to connect all this work and say, what the hell do we do as Oregon? So I look forward to us in the next few months, kind of recharacterizing this stuff now that everything's gone public and, articles in the paper and the like. It's time for us to step up and point out the opportunities that exist now.
I don't know about remedies for it already being sent, but I think I would like to see some kind of agreements between board leadership and staff that, like you check each other or something, or that we get brought things like this before they are sent, and that have an opportunity to have discussion and input, because it's disrespectful to us. It's like saying that our expertise is not as important.
Yeah, I apologize for that. This is something that kind of slipped under my radar. It was something that, that we thought would be a supportive statement on Governor Kitsaver's group and, the Medicaid advisory group were going before the governor, and we just wanted to show up and express our support for their work. And this was an attempt to do that. So it was not meant to be disrespectful. I apologize. I totally understand how it comes across that way. We certainly going forward would not do anything like that and make sure that everything would come before the board before it gets settled. Again, if anybody has a remedy that they would like to suggest, or an amendment or follow-up letter to the governor, we'd be certainly happy to entertain that. So for the purposes of time, I wonder if we can move on. We've got public comment next. Mary Lou, did you have something about?
I guess I was just gonna say that the thing that really kind of got me the most was a lot of pieces, but when it started out with on behalf of the Universal Health Plan Governance Board, it clearly sounded like this board had written this. And I just guess I want to say that we didn't, and I don't know that trying to write a letter saying, oops, we didn't, is not probably a good thing.
Yeah,
And,
it's not a good
it probably will just go to the brown file anyway. So anyway, I'm not, but I agree with what everybody said. Thank you. So it doesn't happen again.
We will follow up on this conversation. I really just want to involve Judy in it, and, but yeah, we'll follow up on it, and come back.
Thank you.
We received a lot of written comment this month from various members of the community, and as always, we're grateful when folks from the community take the time to write into us. We received 21 comments that expressed general support for the board's work. Terry Hammond submitted a 130-page document of a solo task force on universal healthcare, which has a lot of interesting ideas in it. An anonymous writer wrote in to ask us to make sure to cover Medicare Part D. Another anonymous writer wrote in with concerns about the burden a universal health plan would place on retirees. Bruce Deloria wrote asking us to consider a buy, don't build approach to the IT system for the universal health plan based on Epic. Jesse Koenig wrote asking us to consider covering psilocybin therapy. Michael Sonleitner wrote asking us if a value added tax had been considered in our revenue strategy. Sean Green, who identified himself as working for a clinic, wrote with concerns about the projected cost of the program and its impact on his business and the economy as a whole. He was concerned it would make it more difficult for him to recruit and retain providers. Daniel Leone commented that he is totally against using insurance companies at all in the universal health plan. He stated it needed to be a grassroots effort, built from the ground up as a free healthcare system for Oregon's people. Milo Melville Orr wrote to ask that rate setting explicitly consider the viability of independent and solo practices, and that behavioral health payment receive the same protection from disproportionate reductions that the draft report already extended to primary care. River Scholl wrote asking that the taxes be progressive. Barbara Siefkin wrote with concerns about what happens to Medicare Part G with the Universal Health Plan, and with concerns about what happens when folks travel or relocate to another state or country. Gordon Kendall wrote to express disagreement with using employers in any way to fund a universal health plan, including an employer payroll tax, and advocated for a progressive wealth tax instead. Krista Carpenter wrote with concerns about affordability. She has been on the OHP Bridge program, has transitioned to Medicare, and now can't afford her Part B premiums. Bezala and Bhatti wrote in with concerns about how the revenue plan will impact medical practices. They are concerned that the various taxes will force independent practices to close or merge with hospitals. They encouraged us to consider mitigating the impact of the corporate activity tax on small practices by increasing the exemption to 1.5 million and mitigating malpractice insurance burden with tort reform or other measures, and decreasing the costs of the plan by restricting coverage to US citizens. Jeff Hance encouraged us to consider a sales tax to reduce the personal income tax. An anonymous person wrote in to caution us against relying on the Elway poll as proof Oregonians would support the UHP, as the poll framed the question as a typical household would pay less for the new plan than they currently pay in total for premiums and healthcare expenses. And 62% said they'd vote yes after hearing that, but the writer doesn't think it's necessarily true that most people would pay less. Rachel Snyder wrote with concerns that even with the UHP, there aren't enough clinicians in Oregon to care for our residents. Vern Sabo wrote to ask that we ensure there is no discrimination in rate setting among different provider types. Amanda Labont asked us to ensure maximum public buy-in by reducing universal health plan costs wherever possible. Ellis Sonachi sent us a recommendation for a federal constitutional amendment to create a secondary currency to pay for healthcare. Marissa Chisholm wrote to encourage us to engage youth in our strategies. W.D. Snyder wrote in to oppose a UHP and the taxes it would require. And then 184 people wrote in asking that we complete a revenue plan by December 2026 that is progressive and easier to understand, with wealthier Oregonians and businesses paying more than those less well off. And a comment that Oregonians must be able to understand it without the need for a calculator or an accountant. Okay, there are no voting topics today, so we don't have any other public comment. So I'll pass it on to Mimi for the executive director's report.
All right, thank you, everyone, and good morning. I'm Mimi McDonald, Executive Director of the Universal Health Plan Governance Board. So providing an update on the work of the board, as mentioned, there's been a lot going on. There is a new board work group, which is for board members who are working on the legislative report, and I will give them the opportunity to talk all about that. But some additional news that sort of goes along with that is that our board member, Michelle Glass, is going to continue her term until November 30th of this year.
Thank you.
So there is that. Thanks to Michelle. Lots of thumbs up, Michelle, if you can't see them here in the room, sorry. I did want to mention two additional items before I get to our budget. So one is actually a letter that came from, it says Senator Patterson, but it is Senator Deb Patterson. It's also signed by Rep. Rob Nose, Rep. Travis Nelson, Rep. Toy Tran, Senator Lisa Reynolds, and Senator James Manning. And this is a letter that was addressed to Chair Belanca. It's included in the board meeting materials, which they thanked the board for reaching out to talking about the delay in the report to the legislature. And then I wanted to pull something out, the information, sort of some direction provided by these legislators to the board to think about what they would like included in the report. And sorry, now I need to switch glasses. Thank you. So this is directly from that. So in order to best support the legislators' decision-making process, a comprehensive plan for implementing a universal health plan should include information about benefit design and payment structures, information about plan governance and administration, identification of one or more financing models that the legislature may consider, description of suggested implementation framework, including legislative actions that would be necessary to implement a universal health plan. So I hope everyone has the opportunity to read through this letter. I think it's really important. And I also am very, very grateful for our legislative champions for being so involved in this work. So take that opportunity. And then,
Did that come in?
pardon me?
I don't recall.
It
came late
just came late in one of the
Yes, oh,
packets, so it will, so yeah, apologies, because we kind of received it not too long ago and
Yeah,
just got sent out.
I sent everyone a text yesterday to remind you like that there were additional materials because I felt like they got added late. so-
There were
so
several
I
additional,
tried
I
to
apologize for that.
Yeah, thanks.
Yeah, thank you. So I just wanted to make sure that, oops. So, other apologies. We're supposed to be on. I'm sorry. Okay, so there's that. And then I did want to bring up one other point. This is a little bit of a something that came to my inbox from the from DOT, which is that and most people are aware of this, maybe not everyone, but that Interstate 5 is going to be closed southbound in the Portland area from September 11th through mid-October. ODOT is anticipating travel times will be 2 to 3 times longer in that area. So some of your, well, all 3 of your staff do not live in the Salem area and live outside, and are respectfully requesting the board to consider, because it would provide tremendous difficulties for us to get here in person for the September meeting. We don't know yet about the October meeting, but for the board to consider having a virtual only meeting in September, as opposed to the challenges that we might have trying to make it here from various places. So I will let you, I don't know if you want to
Yeah,
take care of that now or would like up for discussion, whatever you.
if we decided to have an all virtual meeting in September, would that pose an issue for anyone? Was that okay, just out of consideration for staff?
Well, and others who may be driving too.
And others. Okay,
I have a comment on that. I think we have a lot of work, and I don't think we're as effective when we have these virtual, I'll speak for myself. And so I would appreciate it. I recognize this is a new problem, but if we could at least have some of us meeting in person, I think that'll just be a lot more effective. And I also think we need to consider maybe having, candidly, 2 meetings in September and October. So I know it's going against the grain of that practicality, but I think we have a lot of work to do.
so Mike, you want to come and meet in person? Do any other board members prefer to meet in person in September?
I'm fine with virtual. I think it's harder if there's like, I mean, first of all, we need our staff here
Yeah.
to meet in person. And I think if,
Right, that's true, because there
Those-
would be
those
any
hybrids,
setup for
yeah,
the virtual
yeah.
setup, yeah.
Okay, I yield.
Okay,
No, I agree with Mike, though. I very much prefer in-person meetings. They just do a lot better, so I'm sorry that this is happening at this time, but I guess we don't control everything, do we? So,
You guys could have a watch party. You can have your own get together.
yeah.
Actually, not a bad idea.
You could have a room and just set up something like this.
We could be the river.
okay, so our September meeting will be virtual only. Thanks for raising that, Mimi. And then budget.
And then just the last thing. So first off, nobody panic when you look at the bottom line where it says over and under, and there's only $1,934. So take a deep breath. I will explain. We have not actually gone out and spent $60,000 anywhere that you
What
don't know
happened?
about. Yeah, what
Yes.
happened to it? Nothing happened to it. Some of the changes that happen, there's a couple of things when things are moved in the budget. And again, this is our projected budget. So within this projected budget, when our the way that it is projected out is that that the consultant fees will be the similar amount month to month to month. And then when we have a big tranche of them all at once, it looks like we've spent a whole bunch of money and we still have a bunch more to go. So in the next, and there's also a couple of other expenses that are within the budget, but which really have been much lower. For example, like Department DOJ expenses and things like that have been much, much lower. So I'm here to tell you, I wanted to accurately portray what is in the official budget that's up on available through DCBS. But also to let you know, we have at least $30,000, if not $40,000 still remaining. So we did not go out on a vendor. So just want everyone to know that there's still funds available. There's not a lot. There's certainly not enough for any additional consultants at this time, but I just wanted to accurately portray what's in the budget, and every month it gets revised. So it will get revised again. That lower number should come up. Yes.
Could you remind us how much more we have for Echo Northwest?
Yes, I think.
Or maybe it's on a slide.
No, this one, I'm sorry, I didn't do it this time. We just got their last one in, there was $10,000, I think roughly. So it's pretty minimal. So that's why, try and minimize, the Echo Northwest amount of time in coming to meetings. And that's, I think, all that I have for my report. Unless I have something on the next page, which I don't think I do. All right, that is it. Thank you so much. Unless there's other questions.
Great. So I'm gonna turn it over to Cheryl and to Lee to talk through the revenue plan development and sort of get the board to a place where we can have a discussion about what's in the report.
Okay, well, I first want to say that I believe the draft revenue plan option financing strategy the committee came up with is our best effort that we could make in the 18 months that we have with the resources that we have. And you can see that we spent down most of Echo Northwest. So that said, I think the first draft is the hardest, and it's easy to criticize, poke holes through it, and also it's easier to edit a first draft. But if we had to start somewhere, and I do think it would be helpful to see a side by side of what we're all paying now versus what we would be paying in taxes with this revenue plan. But we haven't been able to do that because we haven't had a revenue plan to compare it with, and the calculator, the same thing. I mean, we have to have some numbers to start with in order to make those comparisons. So I think that's one piece that's missing that would really show people that by and large, most individuals, most businesses wouldn't be paying more, they'd be paying more or less with this revenue plan. So I just want to say that at the outset. I also want to say I was the chair for 17 out of the 18 months we met. We met, I think, 35 times. The public meeting laws were a challenge for sure. And I totally agree with all of you that in person would be best, but we had to meet virtually. That said, in addition to the 35 or so public meetings that we had two committee members, Charlie Swanson and Richard Gibson, who did a lot of work in between with the staff and with the consultant Echo Northwest. And of course, the staff did a whole lot of work in between too. Since we met twice a month, it was sometimes challenging to get all the work done within a week or two, to make sure it was ready for the next meeting. So those were challenges. I just wanted to say at the outset. The purpose for doing this presentation really is to review the record from both the Finance and Revenue Committee and the board decisions over the last mostly 6 months is when we've been making more of the decisions. And then we wanted to review the work of the Finance and Revenue Committee and how it's related then to the subsequent content of the finance section in the legislative report, in the draft legislative report. So we can go to the next slide. Early on, we spent a lot of time on design principles. The first, 3 to 4 months, October through February, we spent time on the principles, and we found ourselves in conflict between some of the principles. From my experience perspective, I think the biggest conflict or tension was between progressivity and the broad base of revenue, because whenever we considered another potential revenue source, then we ran into regressivity. And that happened like several times. And we'll go into the revenue sources we put to the wayside because they were regressive, and progressivity was really important to us, as you know, that's one of our principles. Did you want to add?
I think one of the other ones that are difficult is the simplicity one.
Mhm. Oh, yes, then
Because-
it became really complex.
Became
Okay, great.
complex
Yeah.
because we were trying to do the progressive, we were
Yes.
trying to do the broad base, and it would be kind of like, well, now it gets complicated because blah, 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 and
Yeah,
whatever, and it was
yeah.
like, and so those things, those principles, I totally agree with,
Mhm.
but I don't know that until we started working on it.
Yeah.
That we really saw that, oh, if you believe in this, then it's really hard to do this.
That's true.
So thank you.
And yeah, complexity was another one of our challenges for sure.
Mhm.
And that's why, for example, we ended up not going with the HSRR, which was formerly the PPP. It became really complex. Okay, next slide. So going back, I guess I went ahead of myself here, and I wanted to mention, Lee and Mimi, please jump in. I'm sure all this details. I literally went back to all of the committee meetings and wrote down everything we did, and Lee was able to condense it in these great slides. I appreciate that. So between October and really more or less the summer, we laid the foundation, as I mentioned. We started with the expenditure base. We're working on a guiding principles and an attributes document for a couple of months. As you know, in about May or so of 25, our staffing changed, and we're very happy to have this current staff here. And also, we finally were able to get our consultants on board. So before May-ish, I think we were kind of on our own and working on a lot of spreadsheets, mostly on the expenditure side. And then we really started in May and June to dig into a broad range of revenue options. So then in August through November 25, that was really when we started looking at the core structure of the revenue plan. And we settled on, as the core base of the revenue, employer payroll taxes and the household contributions, the healthcare, personal income tax. I'm going to try not to use acronyms, but it's hard. And this is how mostly our healthcare system is funded today. It's just that the employer will not be in charge, responsible for benefits, and it will be fair because some employers don't pay for benefits at all right now. And then the individual, instead of paying, out of pocket and premiums, deductibles, et cetera, it would be in the form of a tax. So our first preliminary straw proposal was presented to the board in October 16th. And although the board had really great feedback for us, they didn't vote on the straw proposal at that time. So then we refined our proposal between December 25 and March 26. Our last committee meeting was March 17th. I think we'll go into some details later. I think we can go ahead. This is the decision funnel. So we started out with all of these ideas to review, all of the revenue instruments, mechanisms, and considering the principles, as we mentioned. And then we came up with this core framework of replacement revenue, as I mentioned, primarily standing on employer payroll and healthcare personal income tax as the primary source. We considered many other different revenue sources. Corporate activities tax, corporate income tax, lodging, sales, sumptuary, value added tax, a wealth tax, per person premiums, Part B tax credit, EPT tax credit. I think that's about all of them. Through that process, and this had to do with this progressivity, complexity, tension. We eliminated the soft cap. That was definitely one that was too complex. And went to a 50% EPT credit. I know we were looking at, in my notes, I have like 60%. We were kind of trying to figure out what the best option was there. We ended up removing the HSRR, that's household size.
Rate readjustment.
Rate readjustment, thank you. And we replaced the Part B credit with just a direct payment from the state, and we'll go into that a little bit more.
Cheryl?
Yes.
I just, let's say Part B Medicare. I don't know that people listening in necessarily know Part B. It's Medicare. That's all.
Oh, okay, sorry.
Okay,
I didn't
just
even
a
know I didn't say
clarification.
that. Yeah, Part B Medicare, sorry.
Great.
Okay, next slide. Okay, let's see. I was thinking, well, I'll just go with my notes here. I can't see that very well. So the revenue instruments that did not make the model were the per person premium, which had been replaced with the household size rate readjustment. And then even though we didn't, we voted on it in the committee, the board decided to put it aside because it was going to be too complicated. I think we talked about that a little bit more. We also removed, and already said it, household size rate readjustment, there it is, okay. And then we were going to provide a credit in our committee. We did not vote on replacing the credit, but the board voted to just do a direct payment so that people wouldn't, well, I'll go into that later. Okay, so the ones that didn't advance were the soft cap, the sales tax. We did talk about the sales tax some, but it really, as you know, Oregon isn't a sales tax state, so that would have been a really high hill to climb. And of course, that's a regressive tax. The sumptuary taxes, yes.
Can I say one other thing about the sales tax? That the administrative burden of setting it up, since we don't have a sales tax like
Yeah,
other states, that was another issue that was like going, that's gonna take away a lot of what our gain would be. And if we had been a state that had it, we just could say we're gonna increase it,
Yes,
but
and
that was.
yeah, so there was a complexity
Yeah.
issue there too. Sumptuary taxes, we've basically decided the juice wasn't worth the squeeze. And that would have been another high political hill to climb. And then we had talked about potentially having everyone paying in something, so the low income minimum contributions, but we didn't advance it. Again, that was a progressivity issue, equity issue, and we didn't advance that as a board. We talked about wealth tax just very briefly, but I think that would have been something like the sales tax where you would have had to set up the administration, would have been complex. And it had, yeah, we hadn't done it before.
I'd like to say one other thing about
Yes, go
that,
ahead.
that honestly, the way we develop the tax for the personal income tax, it does tax wealthy people
Yes,
at a much higher level
right.
than most people. And so we kind of went that, yeah, maybe we didn't label it a wealth tax.
Yes.
But when you
that's
really
true.
look at the
Good point.
practicality of it,
Mhm.
and I think that there are a lot of advocates out there still pushing on, let's really go for the wealthy people. And we also considered and looked at data that shows Oregon is not like Oregon, like Washington, California, Massachusetts, other states that do have a higher percentage of their
Mhm.
population that fits in that
That's right.
wealthy group. We actually have, to our advantage, we don't have a big disparity. We're one of those states
Right.
where, although on a national level, there's great disparity, there isn't as much in Oregon. So we really, I guess I just want people on the outside who are listening to this to know that we really looked at those kinds of pieces and thought that, okay, what we're doing though really does, for people who are up in the 500,000 and $1 million range, it's a much higher percentage.
Mhm.
Anyway.
Yeah, thanks for adding that. We did for a few minutes talk about the value added tax too, but that would be really difficult. Again, another administrative hurdle for a state to do that as opposed to the whole country.
Mhm.
So some of the things also were because we're trying to do this plan for Oregon and not the whole United States, like all other healthcare systems, it's for the whole. Okay. So just to reiterate, the core instruments we chose were the healthcare personal income tax. Again, that replaces all the out-of-pocket spending by individuals and families. The employer payroll tax, and that replaces employers who pay, currently premiums for their employees to be on a benefits plan group. And the EPT group credit ensures that we're not taxing twice on wages, stacking employer and individual contributions on the same wage compensation. I don't know if
Can you explain this?
yeah, I'm gonna ask Leah if she, or Mimi, if you can go into more detail with that.
Yeah, I'm happy to go into a little bit more detail. So the, I think the main thought behind that is when there is an employer payroll tax, although it says employer, ultimately, most economists and people believe the money is actually coming from the worker because they're getting lower wages. So essentially, if the workers are paying their personal income tax, one hand, their employers are also paying a tax. However, that also ends up reducing that worker's wage. Essentially, that's how they're talking about that, like stacking it all on people who or their income is from their wages. So it's not income from other sources that it would be taxed. The rationale, and this is when definitely if Charlie or Richard's on the telephone, but one of the rationales, like, well, then why have an employer payroll tax at all? The rationale being currently employers are able to receive federal tax credits for a significant amount because of the funds that they pay into for their employees' healthcare benefits. So the employers would continue to get some federal tax credits by having a payroll tax. The employee, if they get the tax credit, would get some of that back. Don't know if that's sufficient for an explanation. Yes, if anyone else
Yeah.
would like to chime in about a better way to explain it, please.
Yeah, we've mulled about this a lot, and it is, it's a little bit of a complex space, but one of the things that I always think about with a UHP is, I do believe that, for any household, that a UHP will cost less to insure that household than what they currently pay now. But the difference is that for a lot of households, especially if your employer is covering your health insurance, most of your healthcare costs are invisible. Something like 2/3 of what is paid on your behalf for your healthcare is paid by your employer. Maybe, in exchange for reducing your wages, and then what you pay in premium isn't the full cost of your healthcare, right? If your employer is paying that. And so one of the ways that EPT credit works is by acknowledging that, if we didn't have an EPT credit, that suddenly your employer is not paying for you personally at all, that you'd be paying this healthcare personal income tax, your employer's paying into the pot themselves, but it would feel more disproportionate because the individuals would have more of that burden. When they get a credit for part of what their employer is paying, it kind of equalizes that a little bit. So it's a way of not having the same sort of workforce tax twice from the employer and for the individual. And sort of acknowledging that it would be less of a steep slope. So many people who are employed and their employers pay their health insurance, their ACPIT would be substantially reduced, often down to zero because of this credit. Because their employer pays so much more on their behalf. So if you take 15,000, if it's what being paid, that's not what's being paid, 15,000 and 10,000 is paid by your employer and you pay 5,000 in premiums. If you got half of that 15,000 back, that's $7,500. So that would reduce your HCPIT to zero. So it would ease that transition from what the current system is to the future system by giving people enough of a credit that reduces their personal liability. That was one piece of it, is to kind of make it less of a steep drop off from the system we have now to this current system, to make it an easier transition so that people wouldn't have suddenly new expenses that had been invisible to them before. But then the other piece of it, if I understand this right, is there are a lot of folks whose income does not come from wages, does not come from an employer. They get interest income or other income. And having an EPT credit shifts some of the burden of paying for a UHP more onto that population. Instead of having the largest burden on the wage earning population, that more of the burden of it, more of the proportion of the cost of it would be shifted to folks whose income does not come from wages, but comes from other sources. So those were the two pieces to keep it in. And we had a long discussion about, should it be 30%, 50%, 70%? And landed on 50% as a, just as a reasonable sort of middle ground for where to place that.
Thank you for that explanation. I knew I couldn't do that. Appreciate it.
I just follow-up comment. I think it would be really helpful to be able to explain that in plain language, in maybe some examples. I think there's a real issue. Please, Charlie's done an amazing job, but when the chair of our committee can't explain it. I just think we need to be able to understand this, and personally, I don't.
Yeah.
And when someone says, well, it's really complex, the hairs on the back of my neck start going off. So, I don't know how I feel about it, but I just think we need to do a better job at explaining
Yes.
it.
I do believe Morgan explained it in his report, and maybe it's just a matter of simplifying it. And I don't know if Morgan.
Some diagrams and some scenarios might help to be able to understand the effects on both employees and employers and how it dovetails with the employer payroll tax and the income tax. Plus, it sounds like there's a dynamic that I just personally don't fully get.
Yeah.
And I'm willing to put my ignorance out on the table.
We had that, we had multiple charts. I think Charlie made the charts. There were charts that showed, for employed people getting a wage and getting their health insurance covered by their employer, and then folks who had that level of income but not from an employer. And it showed with the 50% credit, how it would affect their HCPIT, their healthcare personal income tax. And to me, that was what was like really eye-opening, because you saw somebody making $80,000 and their health insurance was paid for their employer currently, and then with the credit, they essentially paid zero. They just wiped out their healthcare personal income tax. But somebody who was getting $80,000 not from an employer would have a small tax. It would be, 5 or 6% of that income would go to the HCPIT, right? So it laid it out in a way that you could see this huge number of folks at various income levels up to like $80,000, $90,000 whose HCPIT liability would essentially be reduced to zero because of this credit. So he did have a chart and it laid it out, and that was really helpful, yeah.
So does that mean like self-employed to 99 employees who purchase their insurance, if they can still afford to through the exchange, would have a higher burden than people that have employer-sponsored healthcare?
Have a higher burden than people who are employed?
Who these are also
Yes.
employed people.
Right, because they wouldn't get the credit. They don't get the payroll tax credit. Yes, so
Okay, so even
they're,
if they both are making 80,000.
Yes.
One's 1099, one's
Mhm.
W2.
yes. Again, yes, with that progressivity, that everybody will have the HCPIT, and everybody with that progressivity, that first 200% FPL is excluded. So whatever's remaining of their income after that, that's what would have the HCPIT. Absolutely, yes.
So I was gonna say that was one of the arguments, and looking at the aggregate, looking at the numbers of people in Oregon that are employed versus, employed, either self-employed,
Like me.
like you, yes, definitely. And, you know, people like me who doesn't have a job, so being retired. So there are people who would definitely, but if I'm remembering correctly, there was like 80% of Oregonians would benefit from this because they are employed by an employer.
Right.
And so we, sitting around this room, we may not be representative. I mean, Cheryl might be the only, and Helen, they're employed right now. And so their employer would be paying that EPT and they would get the credit. And you and I wouldn't.
Yeah, but you have retirement income, which usually some like people don't unless they make enough that they can contribute to themselves. So it's like a further burden
Yeah.
on that group
Right.
who already pays more taxes in
Yes.
general.
So I'm just pointing out that the purpose of this conversation is to go through the decisions
Yeah.
that have been made to
Okay, yes,
date.
that's been made.
And where we're gonna end up is to say, what do we wanna do from here? What are the models that we'd like to see? Here's sort of the instruments that we've come up with. And we have to ask our consultants and LRO to help us with those models and to run those numbers for us. But they need to know from us what those numbers are, right? So as Cheryl said in the beginning, like, we need to give them, we say like, okay, here's one model where we have a healthcare personal income tax, employer payroll tax, and a credit of 50%. Plus these CIT and CIT. Here, this is a model. Show us what that looks like. Give us a bunch of scenarios, who wins, who loses in that scenario. Give us the rundown of that. And then we want a different model. We want a model where there's an HCPIT and employer payroll tax, but no credit, no payroll tax credit. And then maybe no CAT and CIT. I don't know, we're making it up, but run that model and let's see who wins, who loses in that model and how that all works out. What they need from us is what those models are, like basically what are the instruments we want them to model, at what levels, and then they can run those numbers and give us. So we're just trying to get to that so that we can decide on which models that we think are, you know, best represent our principles and our work. But we just want to go through where we've gotten to so far. Here are the ones that have been considered, not considered. And then at the end of this discussion, we can parse those into models for our consultants to run numbers
Do you
on.
have some draft suggestions?
I do, but not officially, but we didn't want to propose anything. We but we do have the one from the committee and from the
Yeah,
board
we have the
decision.
draft.
We have the
draft
main,
option.
we have the main draft option. We have one that is really worked out. And what we want this board to decide is, how would you modify this to come up with other models?
Sorry, apologies. Morgan Shook is on the
Oh,
call and
okay.
is available if you would like to phone a friend at any point.
Okay, great.
Oh,
Morgan?
Morgan, do you want to jump in about the EPT credit? Did we get it right or wrong?
You guys have it right. I don't want to spend a bunch of time getting it because it is a complex issue. There is a good write-up in the report from Finance and Revenue talking about these issues, but I think you're generally right. Business economists generally think is employee compensation as a percent of overall business revenue, and then that compensation, right? It is net of wages, benefits, and taxes. Although the taxes part, right, as you've seen, can be a bit muddy, but the work in the committee, right, was really to try the nexus, I think as we were saying, around the transition of employers still contributing through a tax as opposed to ESI to those employees, and then crediting part of that to the employee as a reflection of the sort of, you know, complexity between sort of some of that may actually be part of it, some of it may not. But in the end, it helps drive a lot more progressivity in the tax plan on top of the standard deduction and the FPL. So I think you do have it about right.
ESI?
Employer sponsored insurance.
Insurance, thank you.
Yeah, and that idea that your health benefits from your employer are in theory part of your compensation package, right? And so if that goes away, there's no guarantee that your employer is just gonna automatically increase your wages to make your compensation whole again. And so the credit is a way to sort of compensate for that.
I think we also looked at the fact that there are, you know, some larger employers, I won't name names, that don't pay health insurance for their employees. And that the state is really, for the low income ones, of which there are a lot, the state is really bearing the burden of that. And so I think that from my point of view, as member of that committee, I wanted to be sure that all employers were having to pay into this. And then that the credit being, I understood just what you're all talking about, the economics of it, et cetera. And so that to kind of give back at least some of that in a tax credit to the individual. But we did have the discussion, Amy, about the self-employed. We had, you know, the problem is that we've created such a mess in terms of how financing right now goes for all of us. That's very different as we went around this table. And we're a microcosm of the society. And so to try to make it simple, make it progressive, make it fair.
And that's such a departure from what we're currently doing.
Exactly, and to be, and then to be able to explain it, Bruce, so that people can understand it.
Mhm.
You know, but having gone through it, I really do empathize and understand how we arrived here and that it is a little.
This was one of the
difficult.
more complex issues too, by the way, that we tried to tackle. And as Helen noted, when we were deciding on this particular feature, Charlie came up with a bunch of spreadsheets that showed, I can even remember the green and the
But they
red,
had to-
like
yes.
who was going to pay and who wasn't. And it had some scenarios like, an individual was with an employer, an individual was self-employed, person was, had Medicare, you know, and a few others. So
Yeah.
that's good. We should revisit. And maybe it's just a matter of being able to explain it more simply. I think that's maybe the whole issue. So, okay, next slide. Okay, as we noted, there are just, besides the employer payroll tax and the healthcare personal income tax, we have three other taxes that we had agreed on. That's the corporate income tax and the corporate activity tax. We wanted to broaden the base a little bit, and so we increased those taxes a bit. The lodging tax, we added a little bit to. In my mind, it was to compensate for visitor health care if they happen to get sick when they were visiting. I realize there are people from Oregon who will have to pay this lodging tax too. But that was our fifth tax out of five. And then the Part B Medicare payment, I think there's a word missing, but it relieves an individual from, let's see, that there was, it was better to just pay the Part B payment by the state as opposed to offering Part B premiums that did not apply to all of the Medicare beneficiaries. And then we were concerned that those Medicare beneficiaries that would have to keep paying Part B would just stop paying. So we just thought it would be better to pay for it by the state. This did increase the cost.
So
We'll go into that.
Can I just understand this one? The state
Yes.
would pay Medicare recipients illness?
Yes, that's
Yeah.
correct.
Yeah, that's
The
right.
public corporation.
Yeah,
Yeah,
the original
not- I
plan
guess
is
not
that,
the state.
the original plan was that that folks on Medicare would keep paying their own premiums and their own IRMAs, and the healthcare personal income tax. And then get a credit for the Part B premium from the state, but that seemed a little wonky. We're paying everybody else's premiums. It made sense to pay Medicare Part B premiums, and it would be really hard sell to say you have ambulatory services available to you through the universal health plan, but we want you to pay your Part B premiums anyway, just because it's the right thing to do, and then you'll get a credit for it. It seemed to me that people would drop off paying their Part B premiums because they don't need to. They're getting all their ambulatory services through the UHP. And so it just made more sense for the UHP to just pay the Part B payments, the premiums as well as the IRMAs, and then remove that credit. It simplified it, it made it more fair. It just seemed like an easier way to do it, but it did increase the cost quite a bit.
What's IRMA, just for people?
IRMA is the income related Medicare adjustment, I think it stands for. It's the use. So there's a basic premium amount that people pay for Part B Medicare for ambulatory services, and then if your income is higher, you pay more. So it's a progressive increase in your Part B payment depending on your income.
I just want to make sure people
Yeah.
listening,
Yeah.
know what the abbreviation is.
And I just want on the slide, R, is
Yeah,
that
there's just a
revenue?
word.
Yeah,
There's just
there's
a
a
word.
word.
It's a typo.
Okay, thank you.
I meant to delete that first clause and
Okay, that's
I
fine.
obviously got distracted.
That's okay.
My mistake.
It's like, I was just trying to figure out what R was. Okay,
Yeah.
thank you.
The start of removes, so ignore everything. up to the removes.
And Cheryl might go.
Oh, go ahead.
So I had a number of conversations with Charlie and some other folks. So I've tried to understand, years ago, before some of you were born, I was a health plan manager for Kaiser, and even at that time, the Medicare rates coming into Oregon have been less than basically the average.
Right.
And so Charlie looked up for me yesterday, what's the most current information, and I just want to report that if in fact we go to something that approaches single payer, as a state, I think we have a very strong case to say that we should be getting the median national piece. I bring this up because this is billions of dollars. This is not a rounding error, if you will. So at some point, I want our board to at least to look at this as analysis, recognizing this would need congressional, I mean, this is a big deal. And this might be a 2-year effort. However, if we're aiming
Right.
for 2032, I believe that will have a material effect on not what's here, but if we go back to our logic here, you started with revenue replacement. And if there becomes more revenue from Medicare, there's less of a need. It fundamentally changes all the calculations.
Right.
And at least in my opinion, it is so important that we should spend some time in the future, immediate future, looking at this. I suggest at some point, this should be part of our plan. So I know it's a new item, but Mitch Greenlick and I were worried about this 40 years ago, and I kind of lost track, but I'm just sharing with you all. The current figures look like we get about 20% less on what's called the adjusted per capita case payment. Now, Medicare is about 20% of the people, but about 30 some odd percent of our total. So you all can do your own calculations. If you've got, 15, 20, or 25% more revenue, this has a basic and pervasive effect on this. I just want, and now is the time for at least to include, we need to begin to do that thinking, and we need a major effort that might take years, but I think if we're a national pilot, there's a very strong case to be made that says, you want the pilot to be a fair pilot, and if we had median or average national Medicare revenue, that it really is in the national interest to look at this as a legitimate experiment.
That's a really good point, Mike. Thanks. Okay, next slide. So as you know, there was a minority report written by 3 of our committee members. Their main concerns were that we didn't have a broad enough base for the revenue, and I explained, how we went through the various revenue possibilities and ran into regressivity and complexity problems. Saying in their report that more employers, households should contribute at lower rates. Yes,
This is about, like, right now, the employers with $500,000 or less of payroll don't
Yes.
contribute a payroll
Right.
tax.
Right.
yeah,
And households who, like, for all households, your first 200% of FPL, which right now is around $32,000.
that's right.
Is excluded from income.
Yes.
And the argument of this minority report is that shouldn't be the case, that we should lower those exemptions or remove them
Uh-huh.
entirely.
Right.
And that everybody should pay something, even if you are
at those lower.
That's exactly right, and we did consider that, but we always got a lot of public comment concerned about progressivity, and then we ended up casting aside. Again, we had a committee of 7, and some of the votes were very close. Some of them were, and I've got all the numbers on the votes that you probably don't want to hear, but some of there were abstentions, and there were very close votes or ties, which didn't pass. So yeah, there was, these were difficult decisions. Again, not relying exclusively on employer payroll taxes. And then it's true, we didn't get into the startup transition reserve needs very far. We had a start, and we were thinking maybe some of these things would be punted to the transitions committee, and we later learned that it wasn't going to be the case. But we did what we could do on that. And I don't know if any of you want to say anything more about the minority. Oh, one other thing I noticed in the minority report was that they didn't feel comfortable with how we got to the 16.9 billion in revenue replacement, I think, and wanted to know more about how we got from 80 billion to the 16.9 billion. So felt like we hadn't done all of the actuarial work. So that's what I got from the minority report. I do want to point out that the minority report did not provide an alternative proposal. So there wasn't anything specific in there about what this rate structure revenue plan would be.
Sure.
Yes, go ahead.
One of the things, I think Helen said it, but I guess I want to say a little stronger for the record here, that because of those, progressivity and all of those things, that indeed with the employer payroll tax, that we recommended exempting the first $500,000 of payroll that an organization would have. We considered, because we were trying to protect quote small businesses, but we looked at things like, okay, could you put the definition of a small business as having 3 or 10 or some number of employees or less? But that put negative incentives out there so that employers would go, I really need another person, but I'm not going over 10 because that's where I'm gonna have to start paying. Now, supposedly they could do that over the 500,000, no matter how you would try to exempt. But we also were looking at small businesses that they range from, 2 artists struggling to do, some kind of business related to their
One
art,
person.
to a professional corporation with lawyers, doctors, whatever, that pay relatively high salaries. So anyway, all of those pieces, and I guess I just want to reiterate, since we're having this discussion, that people understand how we came to that, and there's no magic number about that 500. It could be, and there are people who are arguing, and that minority report was arguing that that be 250, I mean, that it
Again,
be lower.
yeah, and again, like all of this draft option, it's a draft, it's a starting point. We have to start somewhere.
Yeah.
So thank you for mentioning that.
Propose we
Go
do
ahead.
an early break since Mike and Bruce seem to need one and I need one. It's just so that we don't continue the conversation without all of us here. Can we pause this, take our break and then come back to this conversation?
Sure, so it's 10:13, let's come back at 10:25.
Okay.
It's still-
Let's reconvene and pick up our discussion about revenue. Isabel's gonna restart the recording now, so let's
Okay.
let's reconvene and we're gonna get started. Are we good, Isabel?
Yeah,
Okay,
we
great.
can go to the next slide. So this is the timeline for the board decisions, and we put this, it was really handy to put the yellow stars where the board voted on aspects of the revenue plan, the draft or the preliminary revenue proposal, let's call it that. So as I mentioned early on, we didn't really have a straw proposal until October of 25, so it took us about a whole year for us to get to the point of having a straw proposal. And at that time, at the October 16th meeting, the board didn't approve the proposal, but asked us lots of questions, and we went back and did some more work on it. And then came back in November. The reason why there is 6-0 and there are actually 9 board members is 3 of us were absent at that board meeting. I even checked, because I thought, that doesn't sound right, is because 3 of us were gone, including myself. But the draft preliminary revenue proposal was approved just in terms of the healthcare personal income tax, employer payroll tax, corporate activities tax, and corporate income tax. At that time, the board replaced the per person premium with a household size rate readjustment and a 100% Medicare Part B credit. So that's what was approved in November. In January, there were additional motions, and those passed 8-0. No HCPIT soft cap, we got rid of that, that was very complex. And the second one was going with a 50% EPT credit, and the third was allowing an HCPIT exemption threshold up to 200% federal poverty level.
Cheryl,
Yes.
another thing that I just like to say for the record is that no HCPIT soft cap was again, for people who keep pushing on wealth tax,
Mhm.
what it would have, if we'd had a soft cap, it would have protected them somewhat at the wealthier end. And so
That's
this
right.
took it away. So indeed, I just keep wanting to help people
Exactly.
understand that it isn't that we have ignored the idea of a wealth tax.
Mhm.
We just aren't calling it, but we're putting pieces into it that really do make it so that the wealthier people
Right,
will have a higher tax burden.
right. The way the HCPIT is structured right now, you pay 0 if your income is 200% of FPL or below. And then it progresses from 0 toward 14% currently. But depending on your income, so some people will pay 3%, some will pay 6%, some will pay 8%. The higher your income goes, the bigger proportion of your income goes to that HCPIT. And the soft cap would have said, okay, once you have contributed $50,000 to the universal health plan per year, we'll reduce your tax liability down to, 6% instead of 14%. It would just kind of soften the blow, because if you're making $1 million a year, 14% of that is a whole lot of money. You're well over $100,000 a year contributing to the healthcare of the state. And so the idea of the soft cap was we would put a limit on once you got here, and your tax liability wouldn't go away. It would just go from 14%, back down to like 10% or something. And we removed that. So no matter how high your income is, you still pay progressively closer and closer to 14.5%. So that is removing that soft cap and protecting that lower income group is our strongest effort at making this very, very progressive. Some people pay 0, some people will pay $150,000 a year for this plan.
Right, and then there are people who are giving us input who are saying you're not making it progressive enough. And I think maybe that is part of saying it in plain language and explaining it more clearly, that indeed, from my point of view, this is extremely progressive.
Mhm.
And much more progressive, as I've started to understand, our current state income tax.
Definitely.
That people do tout all over the country that we have this really progressive income tax. And when you really get down into looking at it, it's not really that progressive. And this is much more so. That's all.
Yeah, so in the name of progressivity, we got rid of the soft cap.
Yep.
At that vote.
Thank you.
In March, we were hoping, the committee, Finance and Revenue Committee was hoping the board would be able to vote on some things. So we met on the 3rd of March, and we just didn't get there as a committee. We needed more discussion time. So there wasn't that's why there's no star in March. But we did review our revised revenue proposal. And then there were some more questions. We thought at the time that some of the things we wouldn't be able to resolve by the end of our meeting in March that would be taken on by the transition committee. Okay, so in May of this year, we ended up removing the HSRR. We also replaced the Medicare Part B tax credit with the direct payment. We've talked about that. And we talked more about administrative savings, as you know very well, and I think this has come up with the board too. Many of our committee members thought the administrative costs savings were undercounted. So I think that's yet to be resolved. In June of 26, we did approve a slight increase in the lodging tax as part of the revenue plan. And then we did approve the relative allocation of the revenue across those 5 sources in order for us to do the LRO modeling, Legislative Revenue Office modeling. And reviewed expenditures. Okay, next slide. So just,
Oh, Michelle has her hand up.
yes, Michelle?
Sorry to interrupt. Thank you so much for this, Cheryl. This is so helpful. And Lee, I just, on that last slide, when it comes to the stars, I think this is, to me, when I read the report drafts, I think this is where some of the confusion comes in, because I completely agree with you, Cheryl, that we needed a place to start and that the first draft is the hardest. And this was the work of the committee and the work of the board in this 2-year period. And I also think that when you look at a slide like this, it's easy to think that this is a recommendation. And I just want to check my understanding. Every star, every time I voted as a board member, it was to move forward with the next step in the analysis. It was not to, like, quote unquote approve or make any final decision. It was to say, like, yes, this is the general direction that we think is the best direction right now to go to the next step with the committee or with LRO or whatever the next step in analysis was. But it wasn't to say, yes, we've landed on our final model and this is a formal board proposal or recommendation. And so I just want to check and see, like, is that other board members' understanding? Because this to me is like one of the central pieces of the report draft as it stands. Is I think the draft has a ton of great detail on this work that's been done, and the framing that makes it clear that this is not a formal board proposal, I think needs to be adjusted. So this is, to me, one of the biggest challenges that we have to find a way to represent this work without making it look like a recommendation. Is that I just want to say that, because even looking at this slide, it looks like, the board voted here, the board voted here, the board voted here, but I don't think we were voting to approve a model or even approve a final instrument or, in some cases, percentage. It was to go to the next step.
I would just say, in my opinion, it's kind of a difference in semantics to me. The committee could not make its own it could make recommendations to the board. The committee couldn't decide on moving forward with a particular set of revenue options without the board approval. So what the board was approving was for the committee to continue on with this draft revenue plan option. We don't need to call it recommendations, but we still needed board approval to continue on to our final, where we were at the end, the final draft option that we came up with, our best effort. So we don't need to call them recommendations, but we did need the board's approval to move forward. And each of these steps, we had to build on to get to that final draft option that we came up with, our best effort to date. And again, it's just a draft. And so that's how I see it. Go ahead, Michael. Mike.
Well, I want to build on Michelle's piece, because Michelle, I like you thought this was, directional, tentative, etc. So my question though is going forward, since I haven't met with anybody from LRO yet, and so to me this is kind of a black box. All I know is that I've been assured that we've all identified there are a bunch of levers, and if I take one example, I promised myself I would only do billion-dollar levers today, but I'm going to violate that right now. Let's say there's a small piece where there's been a diversity of opinion on something, and the vote has reflected that. So for instance, if we wanted to, uh, uh, go in the direction of one of the recommendations of the minority report saying we want everything above 133 or 150%, something there, tokenish as it is. But I thought we had agreed that there'd be some interaction with LRO, and I'm just wondering, when is that gonna be?
September. They're coming to our meeting in September.
Okay, so we can be prepared for then asking basic questions, and then from that, maybe looking at some levers then, is that
Go ahead. Mimi.
correct?
Yeah, thank you. So, and also if Morgan, if you're still on there, I'll ask for you to jump in as well. So the Legislative Revenue Office has worked with our consultant and with Charlie and Richard from the Finance and Revenue Committee have also have met with them, and I have met with them as well. And what they have provided for us is when this group presents them with a model, I'll say, with these particular revenue instruments, they are then able to forecast what revenue will come in. So as you know, like that has happened, the most recent one, the information was available at a couple of board meetings ago. So so that is something they definitely need sort of the specifics to be able to run the model. So they can't necessarily off the top of their head say, oh, if you get rid of the EPT, it'll be so much. No, they need to run the model. So it works better. And they will be coming to talk for sure. And I know they've given a presentation. I don't think you're on the board yet, Mike. I wasn't here either, previously to this board about how they operate. And I think that the more specific the ideas that the board has, and we can certainly get it to them. Also, the other side of that is they have finite time, so we can't give them, 20 models or something like that. So does that, I don't know if that helps any, but also if there are questions that ahead of time, we can certainly email it to them so they are ready with those questions.
Okay, so
Yeah,
if
Oh, go ahead, Morgan. I hear you.
Oh, yeah, no, sorry, just a couple of things. That's correct, Mimi. I would say LRO, right, provides these estimates to legislation to support legislation. And so the finance and revenue, right, which kind of thing is really working at the concept level without sort of like drilling down and figuring out the administrative plan and all the specific details you would have to administer it. And LRO has been very helpful in kind of helping clarify certain elements, like, for example, like what counts as the tax base in an EPT, right? That's not a sort of trivial question. And so the second piece there is like they've been very helpful in doing that. I would say what they would say and so what we wanted to do is like take those rates and use better models of the Oregon economy, right, to understand, have a little more, I'll call it precision on the estimates of revenue, given the tax structure that was being proposed. And I would say one clarification too is what LRO is doing is giving us tax liability estimates, not necessarily revenue estimates, because in some cases, right, they probably are closer to what that liability would actually be the revenue when we're making these sort of small changes to the tax rates. But particularly something for larger changes to the rate structure, like is being proposed for certain households and individuals in the income tax, there is likely to be some behavioral response to that. And what they're doing is they don't have a crystal ball around how to look at the elasticity of some of those changes just because they're very large. And so that's kind of why they would say they're looking at these liability estimates and not necessarily revenue estimates.
Morgan, if I can make sure I understand that, what you're saying is that if we give them numbers that, that we think the EPT should look like this with a 50% credit, how much taxes in theory would that raise based on the current status of the economy? And that's what they can tell us. But where that falls apart is if you suddenly put this new employer payroll tax credit in the Oregon economy, we can't predict like how many small businesses are going to go out of business, how many employers are going to stop doing this, how many people are going to leave their jobs and like go to work for themselves or just retire. Like we can't predict
the changes to the Oregon economy that would happen because of a universal health plan. And therefore, it's really hard to predict how much actual revenue we would get from these taxes, because there's some dynamic changes in there to the economy that we can't predict. All they can tell us is, in theory, if the economy stays exactly as it is now, this is how much it would raise.
Yes, I think that's broadly right. I think what I think they would say is like, you're introducing this change, and the bigger the change, the more we don't know what the new equilibrium will reset at, right?
Yeah.
And so
Right.
small changes likely, maybe smaller effects, but bigger changes likely bigger effects that they can't quite forecast to.
Yeah, businesses and households are gonna change their behavior in some way if this were to happen, and so we can't predict how much money we'll actually raise.
And this is a rather big change.
Yes, it is.
Yeah.
Who's first? Amy or Bruce?
I was just gonna say that, I echo Michelle and what my understanding was as we took those votes each month. It wasn't final, it was iterative to get to the next
I
process.
wonder if I can propose getting away from the language of final and recommendation. Because those two don't serve us at all. What has been clear from the beginning of our work is that part of our work has been to come up with ways to pay for a universal health care plan, right? Revenue options. And what the legislators ask for in this letter is one or more models of how to pay for it. And ultimately, it will be up to the legislature how it's paid for. We are not making a recommendation. We're not calling anything final. We don't have any decision-making authority over, if this plan were to be implemented, this is how it would work in terms of revenue. But it is our job to give some models. And so I wonder if we can use language around revenue model option 1, revenue model option 2, and perhaps having more than one model. It also underscores the fact that we are not making a recommendation and nothing is final, but we've thought about different ways that this could be funded. And here are 2, 3, 4 options. Like Mimi said, it can't be 20 options. It shouldn't be 1, because that feels too much like a recommendation. But maybe if we had 2 or 3 or even 4 options of how it could potentially be funded. And the role of this board would be to say, what do we want what models do we want to explore? What models, the committee and the board's work to date have given us one outline of a model, which we're going through now. And we could recommend like 2 or 3 other models that we want LRO to run some numbers on. And then we could present a menu of revenue options, but nothing is final and nothing is a recommendation. Does that work for people? Is that kind of where we think we are?
Yes.
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 Anybody feel like that's not a good place to land with this conversation?
Well, I particularly like it because it says in this letter from the legislators, identification of one or more financing models that the legislature may consider. I actually think this letter, I'm sorry, I'm saying it, Mike, is very helpful in terms of we'll go later onto the writing group, but kind of an outline of what they want. And so this is maybe more direction than we've had in what they're expecting. And so it seems to me that, anyway, I'll stop there.
Yeah. Bruce, yeah, go ahead, Bruce.
I appreciated the discussion. I appreciated Michelle's question because I wasn't around. And I think your question is really important. What I'm hearing is in June, for example, in June, the board approved modeling like 22% tax, not including it in a revenue plan, but for modeling it. I think language is really important. And Michelle, does that answer your question in terms of that what the board did was approve modeling it versus it's included in the plan?
Yes. Thank you, Bruce. I think I agree that language is really important, especially when it comes to the report, which will be public facing. And that's where my clarifying question was coming from, was really trying to get board consensus and check my understanding. I think what I'm hearing is that there were 2 things going on, and they're both valid and important, and they kind of got conflated because we've just been doing internal work. And so this is an important time to clarify before we present our work externally. So what I'm hearing is internally, our committees needed us to approve models so the committee could do the next step of work. LRO needed specifics in a model to run numbers to get us useful information. That's internal process. So for the purposes of internal work, we were doing some level of approval for the work to continue. But when it comes to, I agree with you, Helen, when it comes to presenting our work to the legislature, that's where I think we need to not use our internal language and be really clear about what we are saying. I think it's great if we are able to present more than one model. I guess my question is, do we have the analysis and the time to present more than one model that has enough analysis behind it to be useful? And I don't know the answer. That's just my question. I think it's great if we can.
I believe we do, and it relies on this board getting sort of to the end of this conversation to talk about sort of what we would want in that model. That's where I'm hoping this conversation will land, but I do think we have time, and I think that's our obligation, is to come up with more than one model, and our consultants and our colleagues at LRO are both sort of agreeable to that as an outcome, is that we would have 2 or 3, however many this board decides, options to be modeled and hopefully to be included in our report. But the language around revenue option model number 1, revenue model option number 2, like if that's language that we can start using, I think that would be really helpful. And I would suggest that what Cheryl's going through right now is the first one that we've come up with that is based on a lot of work by our very dedicated Finance and Revenue Committee and our excellent consultants. This is the best work that they can put forward, and that's what we're showing now. And I would suggest that we consider this revenue model option 1, and then to take it from here and decide how we would like to have other models look. Everyone okay with that, or is there? Yeah. Should we do a fist to 5, like just to make sure that everyone's on board? I'd just really like to see that we're all in this together. So fist to 5, like, again, 5 being like, yes, fully 100% on board, I'll champion that idea. 4, yes, I'm supportive. 3, I'm neutral, but I'm not going to obstruct it. 2 is, I still have some questions that need to be resolved. 1 is, I'm against this, and fist means I'm going to block this proposal. So the idea is that we're going to have multiple options, number yet to be determined, and we're going to refer to them as revenue model options. And that we will do our best to build those models over the next month or 2 of this board's work, and then have our colleagues and consultants model those for us to include in our report. So let's show a fist to 5. Michelle, your numbers are blocked by your name. Can you raise your hand higher?
Got it. I think
It's
she had
4.
four.
4.
Four
Okay,
fingers.
Michelle's a 4, and we got a 5 and a 4 and a 4 and a 5 and a 5, 4.5 and a 4. Great, everybody's in agreement with that. Okay, excellent, thank you. Go ahead, Cheryl, sorry.
So in the interest of time, so we can get to these alternative revenue options, we'll go through these next couple of slides fairly quickly. So this is the revenue plan, again, the revenue plan option number 1, evolution, and how we made those decisions. I don't think it would be super helpful for me to read through this, but you can see the decision points were in October, January, March, and then since then, different kind of tweaking the percentages, a little bit of rate change, so, and things getting removed, and we talked about all that before. So next slide. And then I think this is a really useful slide to see how the numbers shifted in what way, either more expensive or less expensive. So of course, the updated expenditure assumptions, we had to go to a later implementation year. We broadened the benefits, more recent numbers, HR1 impacts, that's going to affect the expenditures and the rates. Administrative savings assumptions, I know we all agree that this will lower the expenses, both in terms of the expenditures and the rates. We removed the soft cap again as a progressivity reason, and so that does impact the rates. That makes people who are wealthier pay more, and so that will help us. Removal of the household size rate readjustment. That's very good, that acronym. That will increase a little bit the rates. EPT credit reductions, lower the rates, and I'm gonna call on Lee and Mimi if you want to explain these a little bit more, I guess. We could go through those, and then as I mentioned earlier on, when we were talking about the Medicare Part B premium, of course, this increases the expenditures, I think it's by about $1 billion. And then the higher EPT threshold, since we are allowing for progressivities, not taxing under 500K for the employer. And that does have an impact on the rate, so that's gonna be more. So I wonder, if you all have questions on any of them, or if you want to describe in more detail, Lee or Mimi, any of these.
I can talk a little bit about the employer payroll tax credit reduction. So, and when we're talking about impact on rates in specific, kind of what this is talking about is that if there was a 100% employer payroll tax credit, so all of the money that the employer paid goes back to the worker. What that ultimately would mean is that essentially there's less in the pot of the trust fund coming from the employers because it's going back to the workers. So ultimately, it would mean that the other rates would have to be higher. So the personal income tax would have to be higher, or the corporate income tax, or the corporate activity tax. So if instead of giving 100% tax credit back, you just give 50% tax credit, then those upper limits are lower. And so that is kind of why it looks like if there's so again, if you went from 50%, say, to 30%, the highest number, and here's where the board would decide, well, do we want it to go off the personal income tax, or should it mean that overall the CI corporate income tax is lower, et cetera? Those are board decisions, but that's the rationale behind that. So if that's helpful.
Right, so the EPT credit doesn't reduce rates, but our decision to reduce the credit from 100% to 50% puts more money in the pot, in the trust fund pot, and that's what reduces the rates. We don't have to have such as high of a healthcare personal income tax if we reduce the credit from 100% to 50%. That's where that down arrow comes from. Yeah.
Okay, thanks for that explanation. Mary Lou?
I guess on the direct payment of Part B premium, that when it says it's $1 billion increase, that's over what we modeled if it had been a credit. So it really, it really costs a lot more than $1 billion for us to pay for that premium, but we had already done the calculations as if it was a tax credit. So
An important point.
so I think that's just
Yeah,
an
yeah.
important point to know that doing that is an expensive thing to do. But I think it's the right thing to do, like Helen said. And so anyway, I just wanted to clarify that.
There's also been some commentary that that number might be an underestimate because
Yes.
it doesn't fully consider the IRMA payments. And so it likely is more than 1.05 billion. But again, our role as a board is get it directionally right, like get the model and the proportions and the instruments right. And then LRO will help us sort through the impact that would have on how much money we could potentially raise.
I also would like to talk a little bit about the HSRR, the household size rate readjustment. And, you know, as we look forward to other models, I think we could include again something about a model that does have some way of capturing the size of the household, which we now have totally taken out. And so, you know, that's another.
So that's a consideration for
And
that.
as the committee, we struggled with that because we didn't want to see this increase in cost. And we weren't able to get to that decision.
Right.
That was a board.
One of those, yeah. So anyway, just
Yeah.
a thought.
Okay. Hey, oh, Mike, did you have something?
Yeah, I agree with Mary Lou's question there. And again, focusing, you know, the arrows are nice, but eventually we need to quantify these things about how much it's going up or down, right? And it gets me to another piece. In our transition committee work, Lee created a couple of, you know, scenarios to get us going. I think that's another major lever, and how much you start in 2032. And I would hope that at least we recognize that, if we're gonna have a couple of models, we also have to think through when is this fully implemented? And is it a big bang, or is it 80% initially, or whatever? That will affect the
Yeah, right.
analysis more than most of these factors.
Absolutely.
Dot point 4 in the letter. Legislators is implementation framework.
Yeah, and
I think that's kind of.
We had a great board discussion about implementation framework and phasing it in, and this board was really on board with that, and that was already a part of the draft report. In their current draft report, that's already elucidated in there, that you could do this as a phase in, and that would significantly change how the revenue would work. Yeah.
And it'll change the reserves, and it'll change the transition costs, et cetera.
If I might make a point, there is that is a potential model. I actually asked LRO about this. If the board would like to run a model about what it would look like for the Medicare population to be added later, not to be excluded, but eventually to be added later, what would it look like without that population? So when you all are discussing models, I just want you to know that it may be sort of the same revenue levers, but having different populations is part of the model. So I just wanted to include that so people understand.
Clarification of what you just said. So from a taxing point of view, if you excluded, if we said, let's add it later, okay, then that would have the tax ramifications of those populations not paying those taxes, is that?
That they would be, and again, I'm not a tax lawyer,
No, no, I'm
legality,
sure
but
you-
yes, they could run the model. And there's all kinds of
Yes.
specifics around this, but I will just
Generalized.
generalize.
Okay.
Understanding that there are many people who use Medicare who are not 65 and up, but let's just grossly say that it would be 65 and up. You could exclude that population from the model that they're running,
Okay.
and you would get some information.
Yeah.
So that's all.
So you're right, they wouldn't pay the tax.
That was my question.
Yep, so you can take
Because I
that.
want to be sure that we are thinking about taxing people who aren't going to get it.
Exactly.
Absolutely.
Exactly.
Pretty clear on that.
Okay, next slide. I think maybe this is the last one. So this is just another way of kind of mapping out what the board has decided, that this is what we approved. And again, this is for draft revenue option 1. These are the components we approved. We approved the household size rate readjustment Part B tax credit, but then we superseded that. We got rid of those two things. And then what's on the table now is a final calibrated revenue package. We already talked about the fact that our report wouldn't be a final calibrated revenue package, and then the tax rates and ranges. So that's where we're at. And I think this is where we get to the discussion with next steps, right? Yeah. Okay. I'm gonna hand that over to Helen.
So we've already had really great discussion. I'm really appreciative of that. You can go to the next slide. I think one of the purposes of where we wanted to get to today is to this first question. When we were receiving feedback on the draft report as it exists now, we got really a huge range of feedback from folks about what should be included therefore in the revenue section. And I understand that that was under the assumption that it was going to be turned in September, and now people's feelings about that might have changed. But I guess I just wanted to pose the very explicit question first, is in terms of what we report to the legislature, to what extent should this history and the progress and sort of how we got to this revenue model option 1, I'm going to start calling it RMO number 1, revenue model option 1. We call them RMOs. To what extent should this history that we just went through, like what all the instruments that we considered, what was in, what was out, how we sort of landed on these instruments, should that kind of history and thinking be included in our report? Should it just be an appendix? Do we want to explain to the legislature sort of our thinking around how we came up with this RMO 1? Go ahead, Bruce.
I'll start off. I think it should be in an appendix.
Yes.
Having not been around and listening to people tying themselves up in knots this morning to explain things just to each other, I don't think that's a good thing to have in a report. For us to be talking about the way we talk to language is, I keep coming back to what Michelle said, language is really important. And I think the discussion this morning was confusing to me, and I think would be confusing if in a report.
Okay,
I agree with the idea of an appendix, as we thought about this, that really does help those who really want to get into the weeds, to really understand, how did we come up with this RMO? And, and so I think that, but I think it doesn't need. I'm just really a proponent, and I think this is what we'll talk more in the, when we get to the work group thing about the legislative report, is making it as short and simple as we can. But for people who want to dig into it, then they need to know that we didn't just jump out with this out of
I want
nowhere.
to be transparent,
Yeah.
but we also want to be clear and concise
Exactly,
in
so
how
I'm with you.
communicate.
Okay.
Michelle has her hand.
I see. Michelle, go ahead.
Yeah, I appreciate this discussion and I agree with Bruce and Mary Lou. And I think in some ways, to me, when I'm thinking about a public facing document, I think about one of the things that a mentor of mine who was a communications director nationally throughout his career, he always said, you know, if you find yourself explaining inside baseball, you're doing it wrong, right? Like this is inside baseball. This is our process. This is background, and it's really important. And I think if the report does a good job of explaining the models, that then people who want to, who are able to understand it and read it, then they might be more motivated to understand that context. And I agree that the appendix is the right place for that because it's an important part of the process, but it's not the headline. It's not what we want to lead with, and we definitely want to include it and be transparent. But I think in some ways, this is where I want to leverage some of the resources that our communications consultant developed for us before we unfortunately ran out of time for her, because I think there's some really good guidance in those, and that's some of the work I'm hoping the work group can do is leverage those resources so that we're not asking questions that I think there's really straightforward commitments already, like to plain language and accessibility that would in some ways constrain our decision making and give us some guidance.
Thanks, Michelle. And, go ahead, Mike.
I want to just build on Michelle's point, because I've been thinking, we had our first session last week on this communication piece. I think the critical thing is not just the report, but what's the executive summary, okay? And I think as a board, if we want to be clear and concise, we really have to say a few things. Is one, this is what we think the plan is. Second, this will ultimately improve affordability and access. You know, some basic points, maybe 5, maybe 10. You know, candidly, having done a lot of reports like this that have gone on the shelf, I've failed in many times here, and so hopefully I've learned from this. You know, 1 or 2 pages, and then a report, but also not terribly lengthy, because candidly, people don't read these things anymore. They just don't, and I'm sorry, but they don't. And put anything you want in the appendix. I don't really think that matters a hell of a lot, other than to be respectful and inclusive for people that are interested in it. If we can keep this simple and compelling, I think that's the most effective way of us doing the communication, and I have full faith in Michelle that she'll lead us toward that effort.
Okay, so I've heard several comments about, you know, all of this process work. To the extent we include it, it should be in the appendix and shouldn't be part of the report. Is anyone who feels differently than that? Okay, quick fist to 5, that all of our process and what instruments we include and why, and the justification, that all of that will go into the appendix instead of the report. I just want to make sure that we're all on the same page
Can
here.
I ask a clarifying question?
Yeah.
Right before, because you just said the word instrument that would be in the appendix, so there would be no mention of revenue instruments in the actual report, is that correct?
No,
No, so that what I'm referring to is
I'll put it out
our,
there. Thank you. Sorry.
why we chose which instruments and why we didn't choose other instruments.
Can I
Go ahead, Lee.
ask a clarifying question?
Yeah.
I actually heard 2 different things in that discussion. I heard we want, RMO one, in the appendix, and I heard we want a process in the appendix, so
No.
which is it?
No,
Okay, I have,
not RMO one.
Okay.
So all we're talking about is to what extent should the history of how we got to RMO one be included in the report?
okay,
You know, as opposed to just saying, here's option number one, we would say, you know, here's the process that the committee went through to choose this. That process work of
Mhm.
which instruments were chosen and why, that all of that should go in the appendix.
Thank you.
thank you.
And just, I think this is getting to the third question up there, but I'm assuming there might be an RMO two or three.
Yeah, yeah,
Just check.
yeah, yeah. Okay. So quick fist of five, we're putting all the process stuff into an appendix and not part of the report, because some people did suggest that it be part of the report, so I just want to make sure that we have consensus on that. And Michelle looks like a 5, and then we got a 4, 5, 5, 4, 5, 5, excellent, okay, good. So that we can set that aside. And then we sort of already touched on the second question, besides that narrative that we just went through. And I'm assuming there will be more than one RMO in the revenue section. Should anything else be in, what should be in the revenue section of the report, I guess is my question. We will have more than one option, revenue model options in there. Should anything else be in there about the committee, the consultants, the progressivity, the principles, I mean, all of that could be considered process. Other than the models themselves, should anything else be in there? Go ahead, Mike.
Yeah, I think revenue and expenditure should be in there. I think as much as we can come up with a model for a business plan, I think that's a much more logical way of doing things. I know we are focusing, you know, in detail here on revenue replacement, but there are some major uncertainties regarding all this that are gonna be outside of our control. We've at least got to show the ability to be able to modulate the expenditures to the extent we get or don't get Medicare approval, et cetera. And I think some language relating expenditure and revenue is really important. I know we didn't structure the work in the last 2 years to put them together, but as a board, I think we need to put that together.
Yes, and I didn't mean to exclude that. You're absolutely right. I think that the section on expenditure and revenues are inextricably linked, and making those ties is really important. Absolutely. But in terms of like the revenue itself and what we would put forth to the legislature regarding revenue, other than options, should there be anything else? Go ahead, Michelle.
Thank you, Chair. I personally think that when I think about what would help legislators and the public understand the models and understand the trade-offs that the models represent, I do think including the principles that the Finance and Revenue Committee developed is important and helpful and simple enough to include. And I think that would actually aid in the comprehension of what people are looking at. So I would advocate for that to be included.
The principles, and then a discussion about trade-offs among those principles as well, is that, I mean, obviously that would need a lot of sort of input and revising, but some discussion, like here are the principles we started with, and we recognize there's some trade-offs and some tensions here between these principles. Okay,
I agree.
okay, great.
That's all I wanted was the principles, I think, and then the options. The whole discussion.
Maybe very brief description, a revenue committee was created.
Yeah.
Like, you know, like 2 or 3 sentences about the process of.
2 or 3 sentences of like,
Yeah,
there was a
there was
committee,
a
we had
committee,
a Echo Northwest consultants.
Yeah.
Just to show some.
There'll be more, we can have like all the laid out detail of that and
In the
appendix,
Okay.
but. Yeah, some framing, basically framing.
Let's take these one at a time. Let's do a quick fist of 5 on like if we should include principles, as well as a brief discussion of the trade-offs and tensions among those principles. If you're in agreement with including that as part of the actual report, not an appendix. Let's do a fist of 5 of that. We got a Michelle 5, we got a 5, 5, 5, 5, 5, 5. Okay, everyone's in agreement on principles and trade-offs. And then Amy brings up a brief description of if there should be
like discussion that a committee was created and that we engaged Echo Northwest as well? Okay, that we engaged Echo Northwest to help with that. So we talked about having that process stuff be in an appendix, and what you're saying is just
We
alluding
need
to it.
framing. We need just like, a little bit of framing about like,
Can I make a
Yeah.
suggestion?
Mhm.
We have a great committee to work on this. I don't think it's up to the board to do the outline of what we want them to say. I think we should leave it up to that committee to come back with something and not have us talking about which sentences we all want in the report. I just think that's a level of micromanagement that we don't need.
Yeah, I appreciate that. There was also like so much disagreement among these board members about like what goes in there and what doesn't go in there, that I just wanted to give that work group a little direction about where we want them to focus and not focus, so. So that's a consideration, so we can defer to the work group, or we can hear from other people about what should be in there. Go ahead, Joe.
I'm confused about the work plans deliverables. Are they going to be generating alternative revenue proposals or options?
The work group?
Revenue model options?
No.
Is that going to be done by this board?
yes.
And so we're going to do this in the span of like the next couple of meetings?
Yes.
We may need additional meetings. We may need additional meetings. It's this.
It's about 18 months on one.
May I ask a clarifying question?
Yes.
And this is for, with apologies about micromanaging, but I think this is another crucial point that was brought up and seemed to be a point of, not necessarily agreement, amongst the board members. When you're talking about a narrative about the various revenue instruments, does that include, actual dollar amounts, actual percentages? I think that was a big point. So I would just like to get clarity around that. I think that because that was some confusion for sure.
Can I respond from,
And they're all done. Yeah, that's just.
may I respond? I think when we kind of had things, the cart in front of the horse a little bit, because we were talking about, we didn't have the decision that we would hold the report until December. And so when we voted on that other issue of what be included in the finance and revenue section, in my mind, I voted like I did because it thought it was gonna be September and that we couldn't
Mhm.
really get there.
Mhm.
I'm hopeful, optimistic, maybe unrealistically, but that we can do some much more specific stuff between now and getting the report done at the end of November, or middle of whenever it has to be that, but we have a couple of months. And so I was hoping that at this meeting, and I think that's what we're doing here kind of, is that we could revisit. When I said just narrative and voted for that, it was with that timeline. And now that we have a different one, I'm for having some numbers in there.
Nope, I'm just opening,
Yeah.
I'm just
Yeah,
trying
I know, and I'm
to.
just responding back
Yeah,
to Lee or to whoever, but that's that's how I voted, and like I say, everything changed when we decided that to ask for the extension. Anyway, that's.
Okay, just a clarifying question. So we're obviously in these board meetings, not going to run the numbers. Who's gonna do that in between? Who's working on the numbers? Is that staff? Is
So,
that Charlie and Richard? I mean, who's doing that work? We can't do that here. I mean, we can say, oh yeah, I tweak this, or I'd add this or that, but we're not gonna be sitting here with our,
Yeah,
computers,
really nice.
sending a spreadsheet, that's a lot of the work that was being done in between.
Yeah.
I will offer up what has been happening is that luckily, I don't know how much time you have left in you, Morgan. We've still been able to continue consulting but a limited amount with Echo Northwest. And we do have the opportunity to work with LRO. So again, what could happen in the next month or two, again, taking into account the would be, for example, let's say that the board decided, you know what, I really want to look at this with but include a 5% sales tax or whatever, like some model that, and you could get an answer from LRO. So basically between like staff, and if there are other board members that we can certainly, if we have meetings that are with LRO, we could certainly invite not a lot of board members, but one or two if they want to be on there, so we don't break public meeting law. But usually it's quite transactional, but almost, we ask them a question, they do their research and they come back to us. But again, there is the opportunity to do that. It isn't all the way till December though, certainly.
No.
So it would be in the next 2 months, or it could be as simple as adjusting what is there. What does it look like if there is no employer payroll tax credit, things like that. So those are all within the realm of possibilities. Does that answer your question?
Echo Northwest hold the $10,000 or
A little
more.
bit.
They'll stretch it.
But also that, and we have the expertise from people who have been on the Finance and Revenue Committee who are continuing to work with LRO and have a good understanding with them, and AKA Richard and Charlie and others who have, contribute as well.
So we'll have to really be ready to throw out some alternatives at the next.
Right, and I'm hoping like even now, we just get a flavor. So I wonder if, in terms of this discussion, if we can agree that for now, to the extent we can, we're gonna limit the revenue section to sort of the revenue model options that this board agrees on, and then some discussion of principles and trade-offs. And we can adjust that and add to it and modify it as needed, but for now, that's what's gonna be there, and then we'll keep things in the appendix. And then we trust the work group to kind of put together a draft for us to consider, and then we could modify from there.
And sorry, again, not to belabor the point, but there is will there be numbers involved?
Can we delay that till later? Can we decide that later?
Later today in the meeting?
No.
No,
like at a-
absolutely. I
Yeah,
apologize.
just
I didn't mean
let's
to-
think
yeah,
about what the
apologies.
models are and just kind of think through like,
So
like revenue model option number one is the one we've been considering and, using the 5 instruments that we've discussed. Sorry, did you want to jump in on that or?
No, I guess I was just saying back to when Cheryl's question that my understanding is that Mimi has been working with Richard and Charlie. And that they are willing to continue to do that and to work with Morgan and Mimi and all of that. So I just wanted to enter that into the record and to be thankful for those two people.
Very thankful.
For what they have done and will continue to do. That's all.
Absolutely.
Thank you.
Absolutely.
I'm sorry.
Okay. So sounds like we are interested in exploring other options. So the RMO 1 is the 5 instruments that we've gone through today, which is the healthcare personal income tax, the employer payroll tax with a 50% tax credit, CAT corporate activity tax, CIT corporate income tax, and a small lodging tax. That's model number 1. And we can run some numbers on that and show how that would play out if that were an option. Does anybody want to suggest other models for revenue options that we would want folks to explore? Yeah.
Yeah, I have two variants, and I reference going back to some of Lee's work with it. Let's imagine a big bang, but minus the practicality of getting all of the ERISA groups eligible. So I would sort out a little bit of that and a little bit of the federal employee thing, and just as a tweak. You with me? So in other words, it's not really covering all 4 million, but I would somehow do a tweak on the ability to get all 4.4 million day one. So I'm.
So like a phased implementation, keep the instruments the same.
Yes, so I would do that. The second variable I would do is the thing I proposed before of what if what would be the effect if in fact Oregon got the median compensation for Medicare as opposed to us now getting 79 or 80%. That's a $4 million $4 billion calculation that's gonna profoundly affect
Yes.
not the model, but the numbers.
Right, but I wonder if we could stay on revenue models and then that would be part of it,
Expenditures.
I don't actually, it is part of revenue, that's
It
true,
is.
but we we can't really model that because it's not really within our control to. Oh, I see what you're saying, just have them model if we did get that, oh, okay, yeah.
If you've got that.
So
Okay,
with,
yeah.
with
It
the
would-
lower, revenue replacement target is what you're asking.
Lower,
Same
I got it.
model,
And,
lower
and,
RRT.
you know, candidly would be very interesting to the legislature that'll otherwise kick the can down the road.
Oh, that's, okay.
Could I ask, so for your first model, so what are you, could you explain a little bit further? Are you talking about excluding an employer payroll? I mean, I need to be clear, are you talking about excluding a population that would be contributing or because that it's going to start getting very sticky if it's some businesses, but not all businesses?
Right, and so, I am predicting that there's gonna be some resistance from ERISA-related groups. And I'm predicting that, there may be some difficulty getting the federal employee group in. So, I don't care which is which as much as, all I'm saying is, it wouldn't be the total big bang we were talking about before. It might be some modification of that, and I would wanna look at what's then the expenditure and what's then the revenue. How much administrative savings, in fact, is realistic to do with that reduction.
So, but it would still, you would need to be very explicit about, essentially
Yeah.
about what entities are paying taxes.
Yes.
And
Cause I'm assuming if, let's say I am big employer X. And I don't wanna go along with this because I would rather keep my health insurance piece. Then I believe they will be paying taxes, and so we'll have.
well,
a
you
revenue.
actually,
ERISA says the staff population will always be voluntary, like, we can't compel them.
Right. and
But we
so-
can tax them.
Absolutely.
We can tax them, Mike. So whether they want to participate or not is really their option.
That's right.
But they are an employer in this state and therefore they get taxed with whatever model we have. We don't exempt them. And the lawyers.
I'm
that's what the
probably
ERISA
getting that
lawyers-
in
Okay,
too much
yeah,
detail, but
okay.
I have heard contrary opinions on this regarding
Yeah.
ERISA.
Well,
I don't know what the facts are, and if you.
Read
will, that's
back.
great.
they had ERISA lawyers, really good ones come early on and I think we need to
Yeah.
read that.
I have a memo that I can send you that with the task force commission
Okay.
from,
Yeah.
from consultants.
Yeah.
I wonder about, in terms of a phased implementation model, we already alluded to this idea of excluding Medicare eligible folks.
Yeah,
As a
And
phased
what would that look
implementation, would people be interested in that
yeah.
as one population groups to phase in later, like phased implementation? And then we got the Medicare Act par, I wrote as one model, like what
Yeah,
are,
that
what
would
the numbers would look like.
Mhm.
And both of those would keep the instruments the same as we've just gone through them. It wouldn't change anything about the instruments, just about how it was implemented. Yeah, go ahead, Amy.
So this is more of a question than suggesting another model, but when we ask LRO to run numbers for whatever variants of models we have, will they be using like 2027 and on HR1, you're gonna have
Yeah, always.
way less Medicaid people and so they'll be running.
In fact, our current numbers include those, right?
Okay.
Our current, everything we're using right now also already.
Assumes way less people on
Assumes that.
Medicaid.
Yeah.
And on the ACA.
Yes.
ACA subsidies and.
Yeah.
Medicaid.
As mine.
Bruce says this.
Yeah, Bruce.
So I wanted to suggest another RMO, which is just deleting the lodging tax.
Yes.
Yeah.
Uh,
Yeah.
You can keep the other instruments as is.
And
Let's
then
keep
what
it
does it
simple.
do?
It will be minimal. I will just say, just because the amount that the lodging tax hits in is in the low millions.
Yeah.
So it probably would minimally change it.
That's why I think I'd like us to do.
Mhm.
Number two, just a question, when you talk about numbers, is there gonna be any analysis on the impacts on different businesses, individuals, et cetera, that will come with this? In other words, what does this do to, the 75% of large employers, et cetera.
Right.
To the extent we can,
Yeah, well-
reflecting back to the dynamic
Right.
nature of things, but yeah, if nothing else.
To the
changes.
extent that we can, I would hope that we would
Yeah,
do
yeah,
that.
absolutely.
I think it's gonna be important to understand not just how much revenue it raises, but to understand the impacts it has on
Absolutely.
different income levels, on different businesses, how it compares to businesses prior to after such an impact of the tax.
But-
Great.
But isn't that partially what you said that LRO is saying that really a lot of that's potential behavior changes?
Right, we just have to understand that it's not predictive of how much revenue, we would get, it would just be like, if it were implemented now,
Yeah.
it would be the
Yeah.
taxes that
Yeah, so
would
it-
be raised, yeah,
that's what-
which is a different thing. Right, yeah, but that's what.
Because it's a large change.
Yeah.
And some we may not be able to do, and that will be in the report,
Yeah.
that that's future work, but I think we just need to not just simply have dollars raised.
Right.
And I would just add absolutely that, but I think just to throwing back, as you may or may not remember, Milliman was, that was part of their contract, was to do some economic forecasting. We had to cut back on their contract just because of the timing, so that was not possible, and it's definitely that. Like on a much deeper level than we'll be able to do in the next couple of months is something that we are hoping to have funds available for the phase 2 of the Universal Health Plan Governance Board, to a significant amount of funds to be able to do exactly that.
Yeah, that's a huge part of where we see the next, the 26 to 28 or 27 to 29, or in the biennium, that budget. We put a lot of money in there for economic analysis to really understand the impacts of this. It actually, to be clear, was originally in this one. We had to reduce our contract with Milliman. The delay in signing, there were a whole bunch of things of why we couldn't include it so far. That was originally in the plan, and that's what has to get shifted to the next biennium if we can.
Could we see what, kind of even the wording of what what you pulled out of the Milliman, whatever, that would be helpful, kind of see what
And that
we're
wording
talking
could
about
go in
exactly.
the
And,
next step
and then,
section.
yeah, and then this is, a little off a bit, but, there are people who are still pushing that we should be asking for, more money this biennium, and this, and I know we've said no, and I know, all of this, but and with this very short timeline, it's kind of almost if somebody delivered a bag of money, I don't think we could make it work.
Yeah, I
in the
wonder if
next
we
2
could
months.
just focus on like, if we want to explore any other models, like, let's just try and keep on track
Alright,
with our discussion.
All right.
Are there any other models that sort of would appeal to people? So far we've got a phased implementation model, having Medicare at par is what I'm calling it, with national numbers, and then deleting the lodging tax. And then, yeah, Mary Lou, you mentioned about the HSR.
HSRR or whatever.
Put it back.
Put it back or something like it, some recognition of family size. In the model, and
Okay.
what would that, how would that change it, kind of thing?
Size.
And just to, I apologize, Mike, go ahead.
There was one other piece, I think it's minor rather than major, but a number of pieces of feedback to us have suggested, and part of our own criteria is that we're all in this, it's the all us together stuff, so whether, I don't have a specific proposal about whether there should be some modest amount of tax between, let's say, 138 or 150% and 200%. But there's been, a lot of feedback that we've heard, and I know I certainly heard it in the community meetings I was in, that I'd like to see that model. I'd like to just to see.
To reduce the exclusion for the healthcare personal income tax to
Yeah.
138 instead
Yeah,
of 200.
and maybe have us, as Charlie's been suggesting, a step function, and maybe a very modest, tiered piece. But I would be curious as to, okay, how much is that worth? Because it's not just of the people that are below 200%. It really has the effect of, if the marginal rate starts at 150 rather than 200, it does change the the calculations and
For everybody.
candidly, it's more revenue. And since, you know, people are not gonna, don't necessarily understand marginal versus average tax stuff anyway, that it
Yeah.
might be wise for us to at least consider that.
Okay, so I'm hearing 2 points to that. One is to consider lower the exemption to start at 138%. The other part of that is that a consideration of a tiered tax.
Yes.
And maybe a little bit TBD about where that
Yeah.
tier is. Thank you.
And if we're talking about tiered, I'd like to have us look at tiering the EPT. For, you know, there's the exclusion of the first 500. I suppose we could talk about whether we wanted to lower that or raise that or something, but mostly I'm thinking about the very large employers that right now we just have the flat 9.6 or whatever it is. And so if we were able to somewhat lower the smaller ones, but increase it, because I've looked at some of the data about, especially public employers, the city of Portland, et cetera, in terms of, and Portland Public, what they're paying now for benefits for their employees is well over 20%. And so if we're only going to be taxing them at around 10, they're going to have a great windfall. And so I'd like to look at those larger employers paying 15% or
So,
12% or some other number. And
larger
Larger,
payrolls.
yeah,
Is that
larger
what- so not,
payrolls.
okay.
yeah,
thank you.
larger payrolls. Yeah.
So I thought we were gonna get into with impacts.
What?
That's part of what I thought we were definitively doing with understanding the impacts of the tax. on
Yeah. Okay, right, but I'm just
Thank you
even
for
thinking that we
being
could do the number,
Specific.
you know,
Yes.
okay.
Yeah, that's great. These are all things that we've heard before. It's great to collect them all in one place. Yeah, go ahead, Amy.
I wanted to say on the modeling under 200% or between 138 and 200%. I'm fine with us modeling and seeing what it does, but I just want to remind us when we made that vote, it was based on our values and principles. So I just wanted to reiterate that.
Any other thoughts on alterations to the model? Okay, I would propose that we end the discussion at this point and we will come up with a strategy working with maybe Charlie, Richard, Morgan, of like what makes sense in terms of trying to incorporate some of these ideas and how to move forward from here to show various models to the board and sort of adjust from there. But I think this captures sort of what we're interested in looking at, and we will try to put it together into multiple different models to consider, and we just need to powwow about how best to do that with the folks that we have as resources. Is that okay? Great, thank you all for the discussion, really helpful. Okay. So Mimi, I'll pass it to you to touch base on expenditure. We have spent a lot of time on expenditures at these meetings, and we still have been hearing some concerns from folks, including today, about where our expenditures are. And so Mimi is going to do like just a brief recap of where we are with expenditures. And the purpose of this agenda item is to hear very clearly from board members, what is the piece that you feel still needs work on the expenditures? Like, what is the piece we still need to dig into? So go ahead, Mimi, I'll pass it.
All right, I'm just gonna recommend that everyone who's sitting stand up for 1 minute because I put your brain in a whole different space. Because this is, we're talking about something different, sorry. It's the coach in me. All right, thank you. Okay, everyone, phew. Thank you for humoring me. All right, so as Chair Belenka mentioned, that is truly the goal of today, is that part of kind of the second two parts of identify areas of understanding and agreement with the expenditure evaluation that there is to date, and identify areas which could use further investigation. To get us there, once again, we're going down memory lane, and so just as we did with the revenue plan. What I will show first is just kind of a step-by-step how this, how the board has arrived and has, and with the consultants' help and committee members and board members has arrived at expenditure estimates. And while I'm going through this first bit, step by step, try and keep in your head like areas where you want to hit your stop button. And then we will stop. And I do, the next two slides have more details about the work that's happened here. So, but again, just to kind of go step by step, starting with the Milliman report. So the Milliman data was collected from the years 2023, 2024, and 2025, using NHPA data and also some Milliman proprietary data because they have contracts with so many health plans. So they have a lot of data that's not always publicly available. What they collected that data on was medical and prescription expenses. So in other words, essentially the bills that came in. This is not including at this point any administrative costs. So
Or dental or vision or mental health.
there is behavioral health in there, but there are not that exactly. There's not those sort of, they call them plus benefits. It's not really what they are, but just again, just so we all stay on the same page. All right, Milliman had that information. They trended that using a 5% trend up to 2026. So what that lands us is, all right, in 2026, this is the status quo. This is how much is being paid in the state of Oregon for those medical and prescription drug services. And what that number comes out to is 47.9 billion. So yeah, that's where we are. Now, this is when things will, it's pretty easy to agree here. Things are going to go.
So these have been updated since what's online.
Yes, this is again, apologize. This is what came out. Oh, no, this should be what's on.
Yeah, it looks different.
Oh, you're so
Those ones have been posted.
sorry. Once again, I apologize. This is all my fault. So that it takes a little bit longer. So yes, this is the most recent posting.
All right.
So sub-Q, status quo sub-Q. My doctor is coming up.
So I went to the website and I have this. Did you
Oh,
get
okay,
from the
maybe I
website?
just need to refresh.
Yeah.
Okay.
Okay. So 47.9 billion, that was the Milliman estimate of not of a universal health plan, but what is existing
SQ status quo.
status quo. Yes.
Oh, okay, good.
All right. Now, this again, as I mentioned, this is when things will, people will have different thoughts about this because these are the assumptions. So they trended that, again, still working in the status quo using some different trend values. They had a low, a high, and a medium. Their low was 5.3%. So that's the increase in expenditure from 2026 to 2032 that healthcare costs are going to increase 5.3% every year. On the low end is their low number. They picked a middle number, and then they had a high number of 7.4%. All right, and I'm just saying this is what, those are the numbers that we have. I will say that those are the numbers that we get and those Milliman 2032 status quo.
So they took the 47.9 and multiplied it by 5.3 for all the
Each of the
years
6
between
years.
26 and whatever, to come up with
Low,
64.9 or whatever.
to come up with low, medium, and high. However, I'm going to add something on there. Sorry, a little twist, is that what we did not get in the Milliman report, if you look at it, what we did not have was a Milliman 2032 status quo. So this is when some of we get help from Charlie and others saying, all right, well, the average they didn't do one with administrative fees in that for the status quo. So the 10% admin fee that you see there is an estimate of the average of what it would be for status quo. Just for completeness sake, I'm sorry, they also had included in their numbers something called unreimbursed Medicaid, which was an amount that was actually listed that they pulled from a hospital the Association of Hospitals account saying, well, for every dollar of care that we give, Medicaid only pays us 55 cents. So I can go into more details later, but that is where those numbers came from. And so we have,
Can I?
I'm confused.
Yeah, can I,
Yeah.
clarify? So I think what we used it, so Milliman's numbers are just expenditures, they don't include the admin costs.
right,
Okay,
And so if you look at the low number, which is that 5.3, using the 5.3% as trend, and you get a low number of 64.9 billion for healthcare expenditures. But in order to do apples to apples comparisons with the UHP, we added in 10% costs for administration. Again, this is in the status quo box, so 10% admin. And then pulled out 70 billion for unreimbursed Medicaid. So basically, we made some adjustments for administrative expenses that weren't included in the Milliman report. And that 64.9 went to 70 billion. As that's our best guess for a low trend rate of 5.3%, our best guess of status quo in 2032, if we didn't do the universal health plan,
Yes.
that basically the state would be spending about 70 billion on healthcare.
okay, oh, all right, it's not 70 billion of unreimbursed.
No.
oh, no, I'm
No,
sorry.
Okay, that's where I was kind of going.
So
Yeah,
that's
right,
right,
yeah,
that's
that's
right.
right.
That's why,
Yeah.
yes, the 64.
Sorry, bad slide.
We're using the low trend rate.
Yes, I got that.
Being really optimistic.
Yeah.
And then getting from 64.9 to 70 billion.
Sorry, I should have put it in a
And
separate.
then
Thank you.
with some administrative
Okay,
adjustments
I
there.
was just.
What are
having
you
trouble with how
defining
much
as
unreimbursed?
unreimbursed?
So Milliman has a very specific definition that, again, that they pulled from the Oregon Hospital Association report. They had a specific dollar amount of what the hospitals said that they weren't getting reimbursed for. They put that into their analyses. However, that's actually not money that is in the system. And it's not charity care. So it's not things that are normally accounted for. It was just
Was it the hospitals expressing their losses?
the hospitals,
This thing,
their
they're saying this is how much
theoretical losses.
It cost us to do business and we didn't get this money reimbursed. And so they included it in their expenditures, but it's not real money. They never got paid that. It never was paid from anyone to anyone. It was just their accounting of what they considered their Medicaid.
And it was, and, yes,
So we didn't include it. in-
Okay,
Good.
so, and as I mentioned, so now this is where definitely I think that there's been a lot of discussion and we want to hear from board members. So again, there were Milliman adjustments that they made, and what happened was I had like 50 slides and I had to cut these down. So, Milliman made adjustments to enrollment, which makes sense, getting up to 2032. They made now we are trended to, now we're looking at, if you look one box over, the universal health plan. So now we've just left the land of status quo. Yes,
okay, unless I'm doing my math wrong, are you saying if I take this 64.9
mhm,
and I increase it by 10%,
mhm.
that, or what number, then I come up with 70, I actually came up with 71 point something.
Right, and that's where I took out the unreimbursed Medicaid.
Oh,
And subtract, that's
Sorry,
subtraction. sign.
whatever that.
Sorry,
number
and really,
There's a minus sign.
this is not meant to be like super duper
No, no,
detailed.
no,
So,
okay, I
but
just-
yes, no, that's a
yeah.
great question.
Right,
Whether I
yes,
just
not the
yes,
70
we add the admin
percentages.
and then minus the unreimbursed.
Okay, I
Medicaid.
didn't, and we
Yeah.
don't know what that number was exactly, but okay.
Yeah,
I guess
it
this
is
70.
available in the
That's fine.
Milliman report.
Okay.
So
Thank you.
again, this is, I think, where the point
Okay.
has come up. Is in the Milliman taking what was status quo, adjusting it to the universal health plan that we need, because we do need to have an expenditure number, as Mike has pointed out, like we need to have something to shoot for. So when you look closely at the Milliman report, again, they make assumptions about what enrollment will look like, about adding the additional benefits so they're available to everyone. So that includes, vision, dental, fertility services, some other things. They make assumptions about utilization. So this is, I think, and we'll get to this more specifically on the next slide.
Mhm.
Utilization meaning two things. One will be that there will be people who have not had
Pent up demand.
Yes, thank you. So, thank you. Pent up demand and also in migration.
Mhm.
So, and those are some of the assumptions that people have questions, and of course, costs. They also commented upon in their report about collectability, that instead of providers not being able to have 100% collectability, that under a universal health plan, indeed they would. And they also did not, they commented about potential provider administrative savings, but they were not included in the Milliman estimates. So that's where we get to the next box over, which is the Milliman Universal Health Plan estimates. And so you have your low, your medium, your high. And again, and we'll go into the next slide talking about where we think that perhaps these estimates should be changed. Now, some of that work has been done by this board and by the transition committee has done a lot of work. So did plan design and expenditure. We spent a lot of time talking about payer administrative savings, and those were incorporated into accounted. We included the accountability. We included a small amount, and I know this is another point of concern, of prescription savings and fraud, waste, and abuse savings. So having said all of that, you still have a status quo roughly in 2032 of 70 billion and a UHPGB of 66.7 billion. There's a difference. And the next part, if we can go on to the next slide, this I think is where I would like to get feedback about whether the if there should be further investigation into some of these numbers. And so I'm going to start off first with, and yeah.
Recap, do you mind going back one slide?
Oh, sure.
So I like to call that last one sort of the board revision, because
Thank you.
what Milliman did in the third box on the bottom, what Milliman did is with their, adjustment. So the UHP is going to do more than status quo in terms of how many people are involved in the benefits. It's pretty, they had a pretty conservative admin amount for both payer and provider. And they came up with low numbers, 77, 85.5, and 94. So that medium 85.5, that's the basic Milliman number we've been using as our expenditures. They were conservative with that. It's their best estimate. It's not the low or the high, but we've been using 85.5 as our number. And this board expressed a lot of concern about that it didn't really reflect all the potential savings. And so what this board did, not Milliman, but what this board did is we started at that 85.5 best estimate, and we tried to get it down even lower. First of all, we started using the low estimate for trend at 77.4 instead of their 85.5. And then we did a lot of work to think about, where are the provider savings in here? And are there more prescription drug savings that we could find, and fraud, waste, and abuse? And what did Dr. Khan find in his studies? And we heard from him, we heard from Dr. Chow about the potential savings there. And we took those Milliman numbers at that second to last box, and we adjusted them further down by 10 to 15 billion dollars. So if you're using the middle number of Milliman number of 85.5, we got it to 66.7, and that would be close to $15 billion of less expenditures. We were going off that low number, which again, there's some question about whether we should even do that, but even that low number, we're still down $10 billion from what Milliman predicted with expenditures, because this board felt that there were more potential savings than was acknowledged in that report. So that's a lot of money. If we're talking about, a total plan of around 70 to 80 billion dollars, $10 billion reduction is like on the order of 15% less than what our consultants and actuaries predicted it would be. I'm worried about that. We should be really, really cautious about how aggressive we are at estimating expenditures on that level. It's fair to pull in everything that we can, but we've got to be really careful here, because if we are off by those kind of numbers, that's going to put us in the hole very, very quickly. So that's what we've done so far, is reduce Milliman numbers by 10 to 15 billion dollars. And so the question is where in this are we still worried that we haven't done enough with expenditures? what, do people have remaining concerns and think that that number needs to come down even further? Go ahead, Mike.
So. In conversations I've had both with people in Oregon and some of the Kaiser people and some international stuff, I get a consistent feedback that that a monopsony can clearly get more than 15% savings in terms of drugs. So that doesn't mean it will happen. I mean, pharma will fight that, but most of the feedback I'm getting is at least 25%. The Yale study that Bruce referenced claims over 50%. But that's in a different context if it's a national study. But even getting half of that, again, gets you to 25%. I think this will clearly require a much more aggressive strategy for Oregon than we're currently used to. So it means not just depending on studying 10 drugs a year stuff. I mean, so this does assume a bold approach. So I can also argue, are we really capable of doing that? But if I look at aspirational stuff, I see no reason why for drugs, for DME, for certain supply things, that there are much greater savings than about the 15% level. So I just want to propose that, recognizing I can also argue against that. But my own sense is there's a few billion dollars.
So the question though is what number should we use for our models? Should we count on that kind of reduction in pharmaceutical expenditures as we build models? Or should we allude to the fact that that's potential, but we don't want to count on it in terms of building our models?
It's a great question because I can clearly argue both sides. I'm really saying though that in terms of, especially off the record conversations with various people, they're basically saying we're not assertive and aggressive enough.
How about one of our models, including the Medicare at car and the RX costs, put that in the same model, that we would build a model based on like a 25%.
An aspirational.
An aspirational model of a 25% reduction in pharmaceuticals plus Medicare at car.
That would be great.
Okay,
Yeah, that meets all my objections.
great, okay.
Yay, thank you. Okay, well then
Bruce has his.
oh, apologies, yes.
I would just, I think this is of critical importance. I think what we've been talking about, whether it's about revenue or expenditures, would be the biggest change in Oregon ever. And I would say that we need to have all these numbers vetted by somebody else as well. When you say, are we too high or are we too low? Yes, is my answer. I really don't know. And I think we need more input, and that just speaks to our credibility. And we may not have the dollars to do that right now. So I think we're gonna need to explain more what needs to be done. Because I don't think we want to be wrong. And I think we want to get the best numbers we can and the best expertise. So I would just, appreciate that.
Right. I agree, 100%. And, so far, Milliman is a nationally recognized firm, and the best numbers that they came up with is that second to last box, that they encouraged us to consider expenditures at 85.5 billion. And this board wanted us to really look hard at that, but that final box, I agree, needs a whole lot more vetting. And that is part of the next phase of our work, if that's where we are. But I think the honest answer is we hired Milliman, we paid them a lot of money to give us their best estimate of what 2032 UHP expenditures would be, and their best estimate is 85.5 billion. And so there's really good reason in my mind to stick with that number, but the last box reflects the work of the board that's happened since then. And those are all potential and need to be vetted, right? There's nothing certain or guaranteed. It's just theoretical and based on other models or other countries. It's kind of like in the ether. So we should just be really careful about that. Sorry, who was next? I don't know.
I think Mary Beth.
I guess I'm gonna channel Dr. Chi since he's not here. talking about especially I feel very comfortable with the administrative savings on the provider end and the plan end. Especially this plan end where Milliman, in my estimation, was building another big insurance company. I mean, and that's where I said on that, the minutes where they included marketing costs, they included some other things that we really wouldn't have. Maybe it's just a labeling thing, I don't know, but overall, those estimates, that chart that, had 15,000 employees, I'm just kind of going, this is craziness. And some of the stuff that they built in there. Also their pharmaceutical one, when we listened to their presentation on that, I thought it really wasn't very good. It still had PBMs and it had all this, rebates and all this kind of jazz that I do think if we really had everybody in the tent and we really were doing this plan right, that we wouldn't do those kinds of things. So I feel comfortable, I hear you, Mike, you think there's still more. I think that I honestly believe this list that we have, the next slide, I guess.
2 slides ahead, I think.
Is it
looking at?
Are you 2 slides ahead?
Slide 28, maybe?
Yeah.
Okay,
That one.
yeah, let me put my glasses on, make sure that's the one. Yeah, that's what I'm looking at. I personally feel this is defensible. And that,
What you're referring to, what exactly? Sorry.
well, the provider administrative savings of 6.4.
Oh, I see. Okay.
Okay, and the provider collectability issue. And lowering the plan administrative cost down from what they had suggested. And can clearly say that what they were building, in my mind, was not a universal health plan. I hear you, Mike, but I'm okay with that we did a modest drug savings, and also this fraud, waste, and abuse. It's probably, in my mind, even more that we can save there, but I'm pretty comfortable, Helen, with going down. And I agree with Bruce that it would be great to have, some other, but whether,
Vetting
Yeah.
both the Millman numbers as well
Yeah.
as our adjustment.
but,
Yes.
but anyway, I guess I'm just saying that I'm not as uncomfortable as you are, Helen, about that. Because it just, the sniff test to me is like, we have got this very expensive, chaotic, terrible system. And to say that the status quo, that when we pull everybody under the tent and we have rules and we do all these things, that somehow it's going to cost, another $15 billion. And I know we're adding more people and I understand those things, but I guess I'm pretty comfortable with going with the lower number.
And I just want to comment on the in-migration piece.
Yeah.
Having heard this
Can you go
for
back one?
decades about when we've done the Oregon Health Plan, how many people would come here. I've heard a lot of different things. I've heard that people will now leave the state because we're taxing them too much.
Right.
I've heard that providers are gonna leave the state because we're having a single payer plan. And now I'm seeing that we're gonna have increased costs because people are gonna come here. I just question the in-migration issue.
Yeah.
That I don't think you can say people are gonna come here, but yet people are gonna leave because the taxes are too high and they're all gonna flee to another state. So I just question the in-migration piece.
Yeah.
I've never seen it happen in our public policy here in this state over the past decades.
One of the things that came up that wouldn't apply to our previous healthcare reform efforts, but would if we had a UHP, is the idea of medical tourism. And the idea that people would rent a home for a month and claim residency and seek services, or they got denied their knee replacement in their home state, and so they, come to Oregon for the summer and get it done here, right? Like that there are ways that cancer treatment, that people would have enormous out-of-pocket costs for their cancer treatment in another state, and they could temporarily reside in Oregon and get care here and then go back home. So, and that wouldn't exist with other reform efforts that we've had, and we don't know if that'll happen and to what extent that'll happen. We have no idea, but it could happen, and Milliman's argument was we should acknowledge that there's a possibility, and of course, they erred on the side of being conservative when they put it.
They acknowledge it's a total guess. Nobody has any idea what would happen or how it would be balanced by other people leaving. But to the extent that there might be increased costs for medical tourism, the way we determined eligibility is pretty generous, in terms of residing in this state and how you claim residency in this state is pretty generous. And of course, we'd have to go back and check 6 months later and make sure that they actually were like legit residents, but you could move here and get care and then go back home, and so we just wanted to account for that.
You could do that on Medicaid though, and they didn't. I mean, our Medicaid benefit is much richer than many other states.
Much richer than many commercial plans.
Yeah, and so I'm just saying.
One
that's-
argument is the population of folks who engage in medical tourism likely
Are
isn't the Medicaid
richer.
population.
Yeah, it's the richer.
Likely, we don't know. Again, we don't know. It's just.
And what can we do to prevent that?
I don't know. I don't know. And so someone on the Plan Benefits Committee suggested we should actually do that proactively, like have a medical tourism sort of, I don't know, committee or office or something like that to monitor it, to understand like what's medical tourism and what's not, and to kind of make some rules about it. I think it's a really tricky issue and I'm not sure how to address it. But we had a pretty robust discussion about it and Milliman wanted to include a little bit of money in there to account for that in case it happens and to the extent that we can't prevent it.
I just wanted to respond here, but in a different way. I think there's all kinds of risks. And while we have experiences and the like, I agree, there's high level of uncertainty in any numbers we come up in a definitive way. But I also think there's a tool. Now, imagine we're not the board that's creating the plan. Right now, we're architects. At some point, there's gonna be a governing board that's actually gonna oversee the management and leadership of this. There's lots of ways one can do. So, for instance, we can suggest a dental plan. But if it becomes apparent in 2032 that you're not gonna make it with a maximum of 1,700 or 2,000, you make it 1,000. There are things one can do with the emergency benefit. There are things one can do in terms of formulary and other management stuff. So there, I want to give folks a sense that at least in looking at things internationally, especially some of the Asian countries that have done this, not just Taiwan, but South Korea, Singapore, etc. There are some levels of control if you assume this is a public new corporation. It'll be a very exciting place. You'll probably be able to get some of the top people in the country to want to work in this kind of environment. It'll be the first state that does something like this. I think it has immense possibilities for managing risk and managing the uncertainty piece.
Yeah.
And that to me is the piece in this formula that I hope will make people less nervous, that in fact, this thing can happen. There are all kinds of ways of modulating it. And finally, if there isn't enough provider capacity anyway, all this imagination that we have access issues now. We will probably continue to have access issues. So I think I'm less nervous than some of you about. In fact, I think we're going in the directionally correct game, and I do think there are additional things we can moderate to in fact make further reductions.
So, thank you. No, so I just wanted to kind of, great discussion, and this is absolutely what we're trying to look at. And again, for purposes of agreement for making our revenue plan models, we do need to have a target, an expenditure number. And so what I am hoping to do, and because there has been a lot of discussion or people sort of bringing up points that make it challenging to keep going forward. So I'm hoping to get to some agreement on this number, we recognize it's not perfect, but we're going to live with it, or it is so imperfect, I need you to do something about it, is kind of where we're at right now. So, I mean, I think that in migration, there's actually a lot of data that's available, not so much Oregon specific, unfortunately, but there's a lot of state and some more recent studies about in migration. So kind of what I'm trying to get is direction from this group. Is that a sticking point? Is that one you're like, well, there's so much that we don't know, just leave it the way it is? Don't change the revenue or the revenue replacement target over that, or no, that we need to do something about it. So, and that's why I put the enrollment increase due to in-migration, because that's been brought up a fair amount. Certainly been brought up by advocates as well.
I'm trying to understand, maybe, because I'm looking at,
You're missing.
am I
The one
missing
that's.
my glasses on
Yeah.
here?
Okay.
Maybe this one? Oh,
Yeah,
okay,
that's
all
the one
right.
we're talking about.
Thank you. Okay, my slide was, okay, great.
So it's a couple of $1 billion, which makes it, so this is $1 billion lever, as we were talking about millions or billions. Is this, but I'm gonna actually even go back to, I think what Helen said and what Mike was talking about as well. Does it make sense to have a low ball number, like best of, Dr. Pangloss, best of all possible worlds number for a revenue replacement target based on our most rosy estimations, including pharmaceutical savings, including there's some data that shows that there's only minimal in migration, et cetera. Would that, and we would present specifics for that, have that be one of the numbers that can be run, because in terms of LRO, it's actually relatively easy for them. If we just give them a different number, but the same way that they run it, that part's pretty easy. Would that be helpful? And I think then we could sort of recognizing there's a lot of uncertainty, not keep coming back to this issue.
Right, so the question is, do we feel comfortable with these numbers as they are, or do we need to spend more time on expenditures to sort of nail down which we're using? The current expenditure estimate that we're using is the board modified one, which would land us at 66.7 billion. That's the one that we're currently using for our revenue replacement target. And I think given the time of the meeting and the remaining agenda items, like I would say, we could just go with that number. We could do a range between that and Milliman's best estimate. Or we can say we're not ready to use the expenditure numbers. We've got to dive into these more, and then we keep it on our agenda to keep talking about it at future meetings.
So slide 27 and 28 then, I guess, okay, so just trying to clarify in my mind that the number that we ended up with on the other side, the 66.7 billion.
Yeah.
Okay, is made up of the details
Right.
that are on this next slide.
Yes.
So included is still increasing our number, or rock bottom number, that we're saying we agree with the immigration number.
Yes.
Correct.
And we agree with increased utilization
Correct.
due to access to benefits.
That's right.
Mhm.
Okay.
It just breaks it down of where all that.
And the additional benefits are the PEB, dental, vision, fertility, that
Mhm.
Milliman calls those PEB plus.
Plus, yeah.
Okay, and those, that's, fairly, like 6% almost, okay, they're billions of dollars. So I guess that's why, although I would question some of those a bit, if we include those up ones along with our estimates of the down ones, that's why I'm pretty comfortable with 66.7.
Okay.
That's my personal opinion.
No, that's what we're asking for sure. Further investigation or.
Yeah, and
Or
because I
good
can
enough.
argue any of them.
Yeah.
But I don't have any basis for it except that or something like that.
It's the basis that's the key. I think I'm in favor of more investigation of both the Millman number.
Yeah.
As well as
Some of
our
our estimates.
adjustments. I think it's behoovent upon us that if we're going to say we're plan administrative costs of 3%, that we reference how we came up with that
Okay.
number.
I do have,
And-
Yeah, we can.
But that's what,
sorry,
I,
sorry for interrupting.
I'd like us to be able to look at all of that and have all that and show the
Yes.
justification. So, and again, I would reiterate my ask for some other outside vetting of both the Millman and our numbers. I
So-
just think it's critical.
May I ask in the next, I'm just trying to be a pragmatist. When you talk about outside vetting, and we know that we really don't have a lot of consultant time,
I understand,
Right
I'm
now.
just putting it on the table.
okay?
I mean, we have plenty of leeway also to qualify in our report that we think these numbers need a lot more vetting.
Mhm.
That this is our best estimate, it's very flawed for all of these reasons. This is where we got to, but we didn't have the time or the resources to vet it as thoroughly as it must be vetted. In order to build a comprehensive
I'll
model.
put that in the next steps.
Yeah,
Yeah.
I mean,
It's all about credibility.
right, we can, we are not in any position to like, say these are the numbers, right? Like these are all estimates and approximations for the purposes of building a model. Like we talked about, like at our last meeting, our goal is to show that this could be done, not exactly line by line how it would be done, right? It's just here, like, if you ballpark it and get, like, it's better than a back of the napkin, but you get close enough to what you think you could do, and here's how you could replace that revenue. This is a model of how it could be done. These are 3 models of how it could be done. And then it's just to get enough buy-in to do the investment needed to really vet these numbers. That's what our goal is. Our goal with this report is to get buy-in to do the investment needed to make this a reality. And so we just have to show enough like work and justify our numbers and where they came from to get that buy-in, and then it needs to go to a much higher level than what this board is able to produce.
Guess one of my questions is, I know you've been consulting with Dr. Khan from California, with Dr. Chow from Harvard, I don't know who all these wonderful experts are out in the world that we haven't talked to. I dealt with another actuarial firm when we were starting here at Oregon, and their estimates were really based on the future being like the past. And we argued that we were changing how we were doing things, and so it wouldn't be that, and turned out that we were right. They said, well, this is how Medicaid is, whatever. And we said, well, no, we're having whole new populations in here, we're doing a lot of different things. And so I guess sometimes I kind of wonder, who are these experts out there that we, because it seemed to me that, when you read the literature, that, Dr. Khan is in there, you've got.
We have John McConnell.
I have some, so I don't want it to be kind of like, well, we just kind of whatever, because we have really,
Yes.
we have
Yes.
vetted some of this with some of the quote experts in the world. And then also we've, I hear Mike always talk about the national and Dr. Chi also. And it is very different in the nation. And I keep thinking like, well, Taiwan, people aren't walking next door from someplace, it's an island. And they're not, necessarily coming from places for the medical tourism or those kind of things. But I guess I'm feeling in some ways, Bruce, that some of this has been vetted and talked about, and that we need to reference that and kind of say that we've had some experts that it's not just us as volunteers sitting around this table, and Mimi's done a good job of taking this to some of those experts. That's just my feel. I just don't want to underestimate it either.
No, I think that's a valid point. I think it's how we articulate some of
Yeah,
this.
and we
I
should.
just want to be certain we're not saying,
Right.
we made an
No,
adjustment.
yes, no, and we really haven't. Sorry you weren't here.
But I do also agree with, would be important to show something that is a reach.
Yeah, a reasonable
Yeah.
reach.
A reach, yeah.
Yeah.
I'm comfortable with yielding my objections to the fact that there's not enough expenditures. With the proviso that as long as we have also an aspirational piece, I'm fine with that. I was coming in today, I was gonna be arguing for a range of 60 to 65 billion. I yield, I'm gonna go your number, I don't think is as much of a stretch as what you all feel. I do think that an aggressive, innovative plan can get more than 25% off of both DME and pharmaceuticals and some medical supplies. I do think that there are some other ideas we propose, but in the interest of moving it along, I'm gonna be at least a 4 on this.
You mentioned a range earlier, and I wonder if we could at least run the numbers for a model with the 66.7 and then with Milliman's estimate and just show our rationale for, I mean, just like you've shown already in the slides, of going with a lower estimate, but run both to show the both.
Milliman's best estimate and our
Yes.
sort of adjusted estimate. Yeah,
Isn't that kind of just a subtraction thing of the, we get the revenue,
yeah,
Whatever,
but it'd be
and then
useful to show it
show whatever, but
and explain like why
Why,
we think,
yeah.
yeah.
quote our experts.
I think that's a really reasonable approach to it, and show both. If we did that, if we, in our expenditure explanation, included both Milliman's best estimate and our modifications, consulting with experts, getting it down to lower, if we included both of those as possible expenditures and a lot of caveats that they all need to be vetted, would people feel comfortable sort of putting the expenditure piece to rest and saying that's what we're gonna do?
I would.
I guess the one piece, and I didn't follow the design and benefit expenditure committee very well. But when you really look at kind of the bigger numbers here, okay, I still don't feel like I understand exactly what, when I looked at the PEB, I've got the PEB benefit for dental and vision and all those things, but it's like, I don't know that that was really as specific as maybe I would have liked to have been to explain what those, because that's a lot of money, 4.5 to 5.6 billion. So I think that's also another place that when Mike's talking about
to be better.
management, et cetera.
Needs to be better.
Yeah,
Right, and we would qualify that all of the numbers
Numbers,
there,
yeah,
we
yeah.
need to be better.
yeah, anyway,
And parsed out, like,
yeah,
not all lumped together.
right.
Okay, so again, similar to what we do with revenue, FIS to 5 about, sorry,
One
meaning like-
clarifying, so I just want to be clear, you're gonna talk about a 66.7 billion, we're gonna talk about a Milliman best. Is there a number lower? Is there then the third,
I think we might
or no,
scrap
we
those.
scrap the lower number?
Yeah,
Mike,
Yeah.
in.
yeah. So
At,
just that-
at least for today.
yeah, that the lowest number we would use is
Is
that
66.
66.7. Okay. So is everyone in agreement that for purposes of modeling and just creating the models, the expenditure numbers we're gonna use are two? One is the 66.7 and one is the Milliman best estimate number.
Is that the middle? Woman
Is
middle?
that's gonna be the
Yeah.
85.5.
Yeah.
Yeah.
I'd rather use the Milliman low, but,
But it's a range, like we
Okay.
can show,
all right. It's just.
Yeah, their best estimate is the 85 point. Okay, just FIS to 5 if people are in agreement with that, and if you're not in agreement, it's okay, it just means it needs to come up at the next meeting and we can keep discussing it, so. 5 and 4 is agree, 3 you feel neutral, 2 you still have a lot of questions, or 2 and 1 you still have a lot of questions, and 1 to kind of help us keep digging into this. Okay, so on the expenditure question with the 2 options, Milliman best and our lowest, let's show FIS to 5 for that. We've got a 5, a 3, a 3, a 5.
I'll give you
Sorry,
3.5.
3, and you're a 4, Amy, and then Michelle, 3. Okay, so no one's in disagreement with that, and nobody has further questions, so we'll leave it off the agenda for now and just go with those numbers with a lot of qualifiers around it. Okay,
That's good.
great, thank you, appreciate that. Okay, in interest of time, we're gonna skip the phase 2 overview and save that for another meeting. I want to give some time to Michelle about the legislative report work group and then a report out from CECC before we wrap up. So Michelle, go ahead. I'm going to turn it over to you.
Thank you, Chair. I'll keep this really short because I'm really pleased that the discussion at our first work group meeting, which was last Thursday, the 13th, was very much in alignment with this board discussion, and I appreciate the discussion today and the clarity and the alignment. some of the, because it was our first meeting, it was mostly reviewing the motion that created it, what our charge was from the board, the board policies that govern work groups, kind of just administrative things. We have decided to meet weekly on Thursday mornings from 8 a.m. to 9 a.m., with the exception of the Thursdays once a month when we meet as a full board. So anyone who wants to participate, to watch those meetings, you can register on the website like for any other meeting. And then because it's a work group, like with our other work groups that we've held, we do gratefully accept all written public comment. But due to the very short period of time that we have to do focused work, we are not accepting verbal public comment at the work group meetings to protect that time to do the work that the board has charged the work group with. And instead, we encourage anyone who wants to give verbal comments about any of this, the work of the work group, the work of the board, which is very similar right now, to do that at our regular monthly board meetings or at the CECC meetings. The main focus was to agree that the underlying board report draft work that's been done by our consultants and staff is really sound and great and includes a lot of the details that we're going to need. And to focus on the fact that we want to align that report with our commitment to plain language and with the strategic messaging guide and style guide that our communications consultant and CECC developed last year. And that we also want to balance some of the themes that we had heard from the board around, meeting, of course, our legislative direction. So I think the letter is really helpful from some of our legislative champions that we discussed today, honoring the time invested and the progress made by our committees and the board, and also being honest about the limitations of our work so far and the work ahead. So that's kind of the brief synopsis. Happy to answer questions, and we'll meet again next week. I do have a question for the board, though. Our next step before we had this discussion was to review the board feedback that board members had sent to staff about the draft finance and revenue report. All of that feedback was given with the assumption of a September deadline and before we had this discussion. And so I would welcome hearing from board members if they feel that that is still a useful next step for the work group to review that feedback, since a lot of the assumptions that underlie that feedback has now shifted. So it doesn't have to be today, but if you wouldn't mind reaching out to me directly and letting me know, that would be really helpful, because I don't want to spend time reviewing feedback that you now feel the context has changed significantly. So thank you.
Thanks, Michelle. I had a quick question. I think you and I briefly talked about it, but just for the benefit of the full board, the work group will be sort of going through various drafts, and then those drafts will come to the full board in advance of each of our regular monthly meetings for us to review. Is that right?
Correct. Yes, that was in the motion that created the work group, and that is the intent of the work group. And we don't have a draft at this point, but we will certainly be sending drafts as we have them, and also giving a report like this at every monthly board meeting.
And then if the board members who are not on the work group or any staff members have edits, we would send those to the work group?
You can send them to the chair, which is me. And so to abide by public meeting law, we're trying to, make sure that there's a single point of contact. So please send any feedback to me directly. And that way we don't have any email discussions.
Great. Thank you very much. And thank you for taking on that work. Do you want to say who is on the work group? I don't think that's been made public yet.
Yes, thank you, Chair. So I'm really grateful. I know that there's a lot of work for this volunteer board to do. So thank you to Mary Lou, Mike, and Amy for volunteering for an additional weekly meeting, as well as review time in between. And I also understand that other board members may want to participate and be unable to due to the additional time commitment. So I understand that and welcome feedback in any format that you would find more accessible. So we certainly do our best to take these discussions to the work group and honor the full board input. And also, welcome any other form of feedback that board members may want to contribute.
Thank you. Go ahead, Michelle.
I want to acknowledge and thank Michelle for being willing to extend her board time to cover this, since our rules are that you have to be a board member to be on a work group. And so, it's kind of like, how are we gonna do this? So that's great, Michelle. But then I guess it also raises for me, have we heard anything on the governor's appointees or what's happening on that
I understand
process?
there's been some nominations, but they're not public yet.
Oh, okay,
Mhm.
all right.
Cause I think that needs to be approved.
Yeah.
First.
They have to be what?
Senate approved.
So it's up.
During ledge days.
I know they do, yeah, but I thought when I got, okay, I thought when I thought it was more that it was out there before I was, but,
Well, the individuals may know, but it is not for us to share publicly.
okay,
Let me put it that way.
thank you. Are we happy?
I have a quick
Yes, go ahead.
CC
Go ahead,
report.
CC.
Okay, yeah, so the next slide. So yeah, this is very quick. At our July 22nd meeting, we shared information from the Deaf and Hard of Hearing Focus Group and took public comment. We received 3 written comments and 3 oral public comments. A summary of those were sent to the board yesterday and either are or will be posted soon to the website. And then our meeting next week on August 26th, important for folks to know, we are starting at 4:30 instead of 4 p.m. With board and committee updates, and we will be taking public comment beginning at 5 p.m. And a reminder to the public that you get 5 minutes for public comment at these meetings, where here you get 2.
So come to your meeting.
Yeah, thanks.
Great, thanks, Amy. Appreciate that. Okay, Mimi, do you want to run through this slide about?
Yes, I can briefly. So, we, at the next meeting, we will have, at least for, revenue model plan, I forgot our acronym.
RMOs.
RMO.
Our RMO number 1 with some scenarios will be available because we anticipate that our calculator will be completed thanks to Echo Northwest. I have asked, not yet confirmed, but I'm pretty darn sure they're gonna have someone from the Legislative Revenue Office. And hopefully, fingers crossed, we can just have a brief review of the Echo Northwest Economic Impact White Paper, which is more about the process of evaluating economic impact than the actual being able to do it. Then in October, hope to have a legislative report draft review. That's for the work group. And at some point, you get to talk about what this board would like to do November through June. So those are quick updates. Things may change.
Thanks, Mimi.
Are we gonna have any additional meetings, as was suggested before, or can we get all this work done in the next 2 meetings?
We don't have a plan for extra meetings at this point, but we're certainly open to that. And if somebody wants to propose that as we go into the discussion, but right now, our next meeting is scheduled for September.
I mean, we do have our work group meetings.
Yeah, the work group too.
Okay.
All right.
Great, thank you. So we've run over our agenda a little bit, so it's 12:29 right now. We have 11 folks signed up for public comment. I think what I could offer is 1 minute each for those 11 folks, or somebody could make a motion that we extend our meeting by 22 minutes so we can give everybody.
Motion.
Two
There is a
minutes.
meeting here at 1 p.m. and they do need time to reset this room.
Okay, so we need to be out of here by 12:45.
I would say so.
So we don't have quite enough time for 11 people to give 2 minutes.
Minute and a half.
Yeah, so a
Minute and a
minute and a half.
Yeah.
Is everyone, so there was a motion to
90 seconds.
extend the meeting to allow a minute and a half for everyone?
Yes.
Okay.
I move.
Second. Okay, any discussion? Okay, quick roll call. That's okay with everyone?
Helen Blanca,
Yes.
Conway Cheese not here, Amy Fellows.
Yes.
Michelle Glass.
Yes.
Goldberg, Yuri Richardson's absent, Cheryl Ramirez.
Yes.
Mary Lou Hendrich.
Yes.
Mike Leahy.
Yes.
Okay, thanks. Okay, so let's get started. So we'll start with folks in the room. First, Francia Lockerbie, and then Colin Stackhouse.
And then after that, we're gonna start with folks online. So Christine Kennedy, you'll be third. Welcome, Francia, forgive me. Can you say your name again?
Francia.
Francia, sorry, go ahead.
Okay, well, I'm just here because, my testimony is that when I was 20 in 2003, I ended up being pregnant, homeless, and with a severe mental illness. I didn't have any income, any health care, ended up getting in trouble with the law because of it, where I ended up with a probation officer who finally helped me out get mental health, help, income and everything. And so I'm just here to say that I'm a strong supporter of healthcare for our Oregonians, HCAO, especially for those who are like me, who end up being homeless when they're pregnant and who have no way of getting any help. And that way, then they not have to end up going to jail just to get the care they need.
Thank you, Francia. Appreciate you being here. Yes, thank you. Colin?
Thanks everyone for all your hard work. Can you imagine trying to finish this in 18 working days and submit it by your September 15th deadline? That would be impossible. I'm really pleased to hear that you folks are interested in trying to deliver several financing and revenue options for the legislature to consider and also for the public to consider. And whatever calculators Eco Northwest can bring forward, looking forward to sharing those. A lot of people are chomping at the bit for those kinds of calculators and for that kind of discussion publicly. And once that cat's out of the bag, it's going to be out of your control totally. So as you've known with like the recent news articles that have been published about your work, another thing that's in our control at Healthcare for All Oregon is a new podcast, which we've released just in the last week called the Healthcare for All Podcast, where we've been discussing your work and what's been happening in Oregon. So that's sort of something I just wanted to mention that's been going on, and folks that are listening and you folks can listen to how we're talking about this. And then there's more things that are out of our control. You know, there's a growing movement, coalition, and people who have volunteered with Healthcare for All Oregon, a 501c3 educational nonprofit, that are also taking different actions. And so there's another Universal Healthcare statewide tour that's happening in September that I'm not coordinating at all, but between the 16th and the 19th, between Bend, LaGrange, the Dalles, and Hermiston, and then between September 23rd and 26th in Medford, Coos Bay, Newport, and Astoria. So keep your eyes peeled for more information on that. Thank you.
Thank you, Colin. Appreciate it. Okay, so we're switching to online testimony. First up is Christine Kennedy. After her will be Michael's.
Oh, I'm actually here.
Oh, you're here. Excellent, great. Christine, and then Michael Sonlighter, forgive me, and Sean Green after that. So go ahead, Christine. There's a minute and a half on the clock, and we appreciate you being here.
Well, a minute and a half. Anyway, my name is Christine Kennedy. I'm no longer a registered nurse, but I am a master's prepared nurse and a retired registered nurse. And when I retired, I was in an executive position in a big university hospital in the Southeast, but most of my experience has been in Oregon. And I have been trying to redesign healthcare for my entire career because we just struggle. We have a lot of money. We have a lot of people that need care, but we have a very inefficient system where people like me spend time fighting because I have a patient over here who has these needs. And then I have a system over here that's supposed to provide coverage for them. So you guys are brilliant. Thank you very much. I appreciate everything you're doing. And I just want to say, keep going. And when you message, this is hard work. And we just need to keep going. We've got the healthcare is falling apart behind us as we're driving forward. So this is the time to keep our foot on the accelerator. And thank you very much. It's a lot of hard work. Keep going. We got to do this.
Thank you.
It's for the people. The people, all the people. Thank you.
Thank you,
Thank you.
Christine. Thank you. Next up is Michael.
I don't see Michael Sunlightner or Sean Green online.
Okay, then we'll go to Todd Ferris and then Lynn Mystic Healer after that.
I signed up.
Yeah, we got Mike Huntington.
I don't have your,
Yeah.
yeah, you're on the list. Oh, I didn't know you were here. You were signed up.
I'd like Linda Krieger to go first.
Yep, she's also on the list.
Okay, so Todd Ferris and then Lynn Mystic Healer.
I'm here. Can you hear me?
Yes.
Okay, great. Chair and members of the board, thank you for the opportunity to testify. I wanted to raise a concern that the employee payroll tax rate is currently too low, the employer payroll tax rate, and the board should consider raising it to closer to the 10 to 15% range, while correspondingly lowering the personal income tax rate. Many employers I've been surveying employers and finding that many are contributing more toward employee health care than the current 9.6 or, well, one of the proposed 9.6 employer payroll tax requires. Keeping the employer rate low doesn't reflect what those employers are actually spending today. It leaves money on the table that is currently going towards healthcare coverage and risks being redirected elsewhere instead of just continuing to fund the system we build. So I'd like you to raise that rate. That's my proposal. Secondly, just as importantly, it is the more tax efficient way to fund the system. When an employer pays the payroll tax, it is not subject to federal income tax or payroll taxes like FICA. So it moves directly from the employer to the state, whereas the personal income tax works differently because individuals pay it out of income they've already earned, which means they've already paid federal taxes. So it's more efficient to ask more from the employer than it is for the personal income tax. So I'd like to consider that. Oh my gosh, I have two more things. Also, there's some great savings that can be had there. One is if the doctors pay the same rate for their procedures, no matter where they do it, it's better for doctors, and we can save a lot of money there. I'll have more to say, which I'll submit in written comments. Thank you.
Thank you, Todd. We appreciate it. Yes, always, forgive us for cutting you short, but you're always welcome to submit written comments. We read all of those. I read all of them for sure.
Nice job.
Lynn
Thank you.
Mystic.
I don't see Lynn today, so I think we go on to Lou.
Okay, Lou Sinninger and then Linda Krieger and then Mike Huntington.
Lou, you should be able to start your comment.
Hello,
Hi, Lou.
can you see me?
No.
Can you hear me?
Yeah, hear you.
Oh, good. All right. Well, you're lucky if you can't see me. Anyway, thank you for this opportunity. I got 2 or 3 issues I want to raise. On the point of the calculator, most employees don't know what their employer is paying to healthcare. The other thing is you have to include a question about how much is your deductible. On startup funds, which you haven't approached yet, I propose that startup funds may be gathered with a bond. So please consider that or have somebody check it out. The other thing I wanted to mention is that half the population of Oregon is either on Medicaid or Medicare. This, this is something very important to understand because no matter what we develop here, what you develop, it must be, eventually, it'll have to be voted in. I think that's about it. The other thing, I do support Todd's proposal to take another look at the employer amount of taxes. Thank you very much.
Thank you, Lou. Linda Krieger.
Linda, you should be able to unmute now.
Thank you. Can you see and hear me?
Yes.
Okay. So my comments have definitely changed throughout this meeting. So first of all, I'd just like to say I really appreciate the discussion in this meeting, and I think that there's been some great progress made just today, frankly. What I would urge this board to be, I know you need to be realistic. I would urge the board to be bold. Right now, I think another commenter said this, we're in a crisis situation. The whole country's in a crisis situation. But we need to be bold in what we're proposing. And what does that mean? I heard Mike use the word aggressive and innovative. I think we need to not build in resistance. In other words, we can't make proposals based on who we think will resist the proposals. I know we have to be realistic, but let's not negotiate with ourselves. We know that things are going to get negotiated as time goes on. Using the word aspirational model, I think is inappropriate, because we should be confident in the things that we're talking about. There's been so much work done, so many experts consulted. And don't use the Milliman best estimate for expenditures. Don't put that in the report.
Thank you, Linda. Appreciate you being here. Mike Huntington. And then after that is Tom Sinsick, and then we'll circle back to see if anybody else joined.
Thanks, Chair Blanca. Yesterday, our Mid-Valley Healthcare Board met at this retreat and wanted to extend its gratitude to you here. I would add to Linda's comments that if you can keep it to maybe 1 or 2 proposals rather than more. I agree with the processing of information of the F&R slides through a Hemingway app, something that gets it down to 7th grade level with metaphoric cartoons and diagrams. Governor Kotek, as part of her re-election campaign, called me last week. She said she wants the governance board to succeed. I reviewed some of the reasons the governance board report needed to be delayed, the initial delay, the interpretation of the public meeting rules, limited funding. I asked her to do what she can to increase the administrative complexity rules for providers, namely value-based payments. I heard her nod her head. She wonders.
You heard it.
About that. Senator Wyden has reimagining healthcare interviews across the state. Yes, I want Medicare for all. Let's hold him to it. Reminded him that his stated support of the state-based Universal Healthcare Act last year. And will he do that again? The bill is now sponsored by Senator Markey of Massachusetts, Senator Merkley of Oregon. And then why does the legislative report group need to be public? It's less than a quorum. It stifles bold ideas that particularly limit wanting to be quoted on. So, thank you.
Thanks, Mike.
Thank you, Mike. And Tom Sinsick.
Tom, you should be able to unmute now.
I'm unmuted. Thank you. Well, okay, I'm unmuted now. Thank you very much for your time. I'm happy to be here today. I want to really emphasize what Linda just said. This is not aspirational work. This is essential work. The idea of spending time over worry is time to say, remind ourselves that we should be worried about the medical bankruptcies, the debt, the complexities of the system, the deaths of patients. The Yale study, right? You're all familiar with it now. $1 trillion saved a year and over 100,000 lives. Some of those are right here in Oregon. So, you know, there'll be more time for public comment if we stop having the side conversations with our worry. So a little bit of a scolding here to the people that are putting, over worrying about what we have to do. Certainly the lift is going to be hard. The struggle is there, but we can do this together as Oregonian. Just follow the Oregonian model, right? We can do this. We can be the first. And basically that's what there's a lot of conversations, widen support. We're building support across the state. You're doing your work. It's great that there's going to be more options for people to consider through the legislative process. I think that will be good for the debate that's going to happen in the legislature. We know the conversations are going to go on. So thank you very much.
Thank you, Tom. And then just checking quick with Isabel about Michael.
It does not look like Michael Sunlightner, Sean Green, or Lynn Mystic Healer has joined the meeting.
Okay, great. Great, then we just have a quick reflection and it was my turn to do the reflection. And I just wanted to, call people's attention to this, Netflix miniseries called The American Experiment. It's on Netflix right now. It is fantastic. I highly recommend that everyone watch it. Through the whole thing, there was a lot of parallels with our work. This is a group of really dedicated people who believed in certain principles and then had to put together the paperwork to back it up. And it was just really enlightening to see how much disagreement there was around the formation of our Constitution, how many were adamantly opposed to it, how hard they had to fight to get the basics in line, and then how quickly they needed to amend it. So on the next slide, that was my main point with it, that it was a really aspirational document that was amended nearly immediately because there was so much resistance to how it was laid out. So I just took it as a really great learning for us. It's a fantastic series to watch. I recommend it. And I think if we get this directionally right and understand that right from the get-go, it's going to need to get amended, we will get there. So thank you. And with that, we are adjourned. Oh, we need a volunteer for next month's reflection. Anybody want to volunteer? Okay, great. Thanks, Amy. Thank you, everyone. We're adjourned. Appreciate it.
Thank you.